Good. Yeah.
So if you need to ask Pierre,
Okay. Okay. I thought Lucia was no longer.
She isn't, she's doing half-day.
Okay. 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 All right. Yeah, just go over whatever you think you need to hear.
Yeah, that'd be
Yeah.
great. Good morning, everybody. Welcome to the Health and Human Services Committee. I'm going to have our committee introduce themselves first, and I'll start over on my right with Representative Graham.
Thank you, Mr. Chair. Good morning, everyone. I'm Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105. Little nippy outside and it's going to get colder.
Good morning, everyone. I am Representative Lucian Daigle, and I represent House District 1, northernmost part of Maine, and it's going to be nippier up there.
Hello, good morning. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Hello, my name is Sam Zager. I'm honored to represent House District 116, part of Portland.
Hi, I'm Michael Lemlin. I represent House District 53, which is Chelsea, Randolph, Pittston, and Dresden.
Good morning. I'm Representative Dan Shigori, and I represent House District 55, the communities of Holwell, Manchester, and West Gardner.
Good morning. My name is Julie McCabe. I represent District 93, part of Lewiston.
Okay, go ahead.
Representative Griffin, I see you're on Zoom. Would you introduce yourself?
Good morning, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Condescate.
And I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair.
And I'm Henry Ingerson, State Senate District 32, which is Biddeford, Arundel, Dayton, Hollis, and Lyman, and I'm pleased to be the Senate Chair of this committee. And we have this morning also our analyst, Sam Seneff, and Sophie Dubé, our clerk, and thank you for being here. We have two work sessions this morning, and we're going to go with them as listed in order. LD 1658 will be worked first, and then we'll go to LD 1772. And having said that, I'm going to defer over to our analyst, Sam.
Morning. So we have two carryover bills this morning. They are related, but can be held separate. The first one is LD 1658, an act to preserve and strengthen the Fund for a Healthy Maine. So both of these bills have proposed amendments, and it was largely the amendments that received testimony in the public hearings. So I'm going to focus on the amendments, but I will go over just briefly for each of the bills, the original bill, and describe what the changes are in the amended language. So the original version of this bill sought to increase the cigarette excise tax rate by 50 mils, changing the rate per pack of 20 cigarettes from $2 to $3 and the rate per cigarette from 10 to 15 under what was the current law when this bill came out. When the cigarette tax increases, the tax on tobacco products also increases by an equivalent amount. The bill includes in the excise tax on tobacco products that equivalent increase and specifies the definition of tobacco products includes those with synthetic nicotine. The bill also required the state tax assessor and controller to annually determine the amount of revenue from the taxes on cigarettes and tobacco products that are needed to ensure that the Fund for Healthy Maine receives at least $65 million annually from all sources of revenue, including from the tobacco settlement and from certain slot machine income. And again, that is the original bill. The new bill, or rather the amended version of the bill, is different, and I'll go over that in a second. You did hear testimony both in favor and opposed to the bill. Proponents of the bill noted that the Fund for a Healthy Maine has been destabilized by declining tobacco settlement payments, creating an unavoidable structural deficit, and that is largely related to the fact that there is less smoking, but there is more use of other tobacco products which are not covered in that original settlement, as you'll recall. The budget passed in the first session did address the structural shortfall with a one-time transfer from the general fund, but an ongoing solution is still required. This bill as amended offers that solution by crediting a percentage of tobacco excise tax revenue to the Fund for Healthy Maine. This approach adds an element of equity to funding the Fund for Healthy Maine. People with low incomes are targeted by tobacco marketing, smoke at higher rates, and pay a higher percentage of their income in tobacco taxes than do higher income people. Tobacco settlement funds, again, do not consider the sales of non-cigarette tobacco products like e-cigarettes and vapes. The Office of the Attorney General did testify in favor of this bill, stating that it was a fitting use of cigarette and tobacco products taxes. Opponents stated that the proposed change in funding represents a significant policy shift and a long-term financial commitment, and that more resources should be spent on auditing and fraud prevention. And there was testimony neither for nor against, just noting that tobacco products have been subject to multiple price increases in recent years. Before actually, I think I want to, before I go into the background, I actually want to just go over what the proposed amendment does. So if you go to page 4, you'll see under potential issues, technical problems, issues for consideration. So the bill as originally drafted includes provisions that are likely no longer necessary given developments in the first session. Parts E1 and E2 of LD 210, which is in your packet in the back, increase the tax on cigarettes and tobacco products. Part Y of LD 609 transferred $7.5 million from the unappropriated surplus of the general fund to the Fund for Healthy Maine on or before June 30th, 26, and a little over $20 million on or before June 30th, 2027. You'll also find that copies of those, that budget language in the back of your packet. So the proposed amendment, which is what folks were testifying on and which you received and have a copy of in your packet as well. It replaces the bill with language that requires the state controller transfer 14% of cigarette and tobacco products tax revenue received in fiscal year ending June 30th, 28 to the Fund for Healthy Maine. And for each year following, that percentage is increased by 1 percentage point, and that caps out in 2034 at 20% of revenue. And then in the following years, it maintains that 20%. So you have the list there of what that looks like. And so the policy purpose here is to try to create a stable stream of revenue for the Fund for Healthy Maine. So back to background. So I know many of you have heard this before. We've done a number of bills in recent years related to Fund for Healthy Maine, but just briefly, the Master Settlement Agreement was reached by Maine along with 45 other states in the state of Maine versus Philip Morris. It provided for ongoing annual payments from tobacco products manufacturers to states to compensate for tobacco-related illnesses. So to compensate states for the money that they spent largely through Medicaid dollars to pay for the effects of tobacco smoking. There is a webpage that you have a hot link to in your in the electronic version of your bill analysis that tracks Fund for Healthy Maine funds. The MSA does not restrict how states spend their funds. Maine has a specific law, which again is in your packet, that describes the allowable uses for the Fund for Healthy Maine. So there is, so the state did narrow the types of things that those funds may be spent on. And again, in your packet there, prior legislation, if you've been on this committee for a few years, you have certainly seen these bills before related to the Fund for Healthy Maine. Most recently, LD 1722 resolved to establish the Blue Ribbon Commission to design a plan for sustained investment in preventing disease and improving the health of Maine, which is quite a title. Resulted in this study that came out in January 2024, and there were a number of recommendations that came out of that study. The executive summary of the study is in your packet, and it lists out those recommendations. The original bill of actually really 1772 took many of those recommendations, and you'll see it again. There's a proposed amendment to that bill, but this bill is a derivation of the work from that study. Also, most recently, you heard LD 1523, an act to establish the Trust for a Healthy Maine, and LD 1693, the act to advance health equity, improve well-being of all Maine people, and create a health trust, which sought to create a trust structure to drive how funds that were appropriated to the Fund for Healthy Maine were spent. It created an entirely new structure. You ultimately decided not to move forward with those bills. They did receive divided reports out of committee, and both of them died on adjournment. And back to the 129th, you heard LD 1961, which was I think the first version of the trust bills that you had considered, and that also received a divided report and died on adjournment. Let's see, what else do I want to tell you? You have a number of reference materials in your packet and linked in your electronic version of the bill analysis. So you have the amendments, you have the executive summary and the recommendations of the study. You've got Title 22, Section 1511, which describes the Fund for Healthy Maine and the allowable uses, which is a good thing to kind of keep in your back pocket. And you also have the latest status of the Fund for Healthy Maine. Looks like this. You probably remember seeing Luke go over some of these. So this is this takes into account the December 2025 revenue forecast, and it's looking at out to fiscal year 27 what the fund status will be. So you can see at the bottom that, as you've seen before, the balances, the ending balances, are predicted to decline over time. Which would ultimately result in a deficit. So you can see at the bottom the ending balance for 2026, and that is the beginning balance for 2027, and the ending balance for fiscal year 27 is about 4.5 million. So if you look historically, that number has been decreasing over time. On the next page, you'll see Fund for Healthy Maine allocations. This is how Fund for Healthy Maine funds have been spent, have been allocated in the budget. So that is historical, so you can see it.
Could you just clarify for
Yeah.
for us where we are here?
Oh, I'm sorry.
That's all right.
So in your packet, it looks like this, the landscape version.
Oh, right here.
over here.
Okay,
Yes.
got it. Thank you.
So you can see historically, beginning in fiscal year 17 and up to fiscal year 26 to 27, what the allocations from the Fund for Healthy Maine are.
Yeah, my two files are split up.
It's attached to that. It's in the. It's
Yeah,
stapled.
my packets, I've got. It's fine.
Okay, all right.
Carry on.
So this is just for informational purposes. You can see specifically what programs funds have been spent on and how that has changed over time. A lot of these allocations have been fairly stable over the years. But it's helpful, I think, to have that decade look back. And then the last 2 pages of your packet are the budget language that had to do with the transfers to the Fund for Healthy Maine, as well as the cigarette tax language. So that is what I have for you today. I know that there are people in the room who know a lot about the Fund for Healthy Maine and a lot about the way that this financial structure is proposed to work. So I can answer some questions, and I'm sure there's other people who can answer more detailed questions if you have them.
Any questions for Sam? Representative Meyer.
Do we want to hear from Annie? You look like you're,
You like to come up?
no? Okay,
Okay.
okay.
Further discussion on this? Bill itself or bill analysis?
And I apologize for being late. I
It's
was
okay.
it's a mess down at the other end of the hallway there. So I'm Mary Ann Moore and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County. And I guess the question that I have, Sam, I just want to make sure I'm understanding. The amendment to the 1658 is it deleted all the other sections with the exception of just setting the pay scale to be starting with 14%, 15%, and that is actually a revenue that is already being received, imposed on the taxes. It's not raising taxes. That's
Correct.
correct. Okay.
That's correct.
That's how I understand. That's how I interpreted it. And that's how we interpret it. So I
Yes.
wanted to make sure I was understanding that.
Yes, that's correct. It's not a new tax.
And this is being placed into the Fund for Healthy Maine account, not a sub account.
Correct.
Correct. Okay. Good. That's all I need to know. Thank you.
We have a motion.
With that clarification, I would move ought to pass as amended.
I'll second the motion.
Okay. We have a motion on the floor, to pass as amended. Let's take a vote. All those in favor? Okay, thank you. And before we start on 1772, I'd like to take a few minutes break. And we'll do that. Okay. Very good. Okay, we're back. We're now working on LD 1772, and Sam, I'll turn it over to you.
This is LD 1772. This is Senator Bennett's bill. This is an act to implement the recommendations of the Blue Ribbon Commission to design a plan for sustained investment in preventing disease and improving the health of Maine communities. So again, this is a bill that there has been a significant sponsor amendment proposed. The bill, as originally drafted, establishes the Trust for a Healthy Maine to receive money paid to the state pursuant to the tobacco settlement and from other sources, and to distribute that money to state agencies or designated agents of the state to fund tobacco use prevention and addiction disease control, ensure adequate response for other disease prevention efforts, promote public health, plan and deliver public health and prevention programs and services, support accreditation of the Department of Health and Human Services, Maine Center for Disease Control and Prevention, and support public health workforce development. The trust is governed by a 15-member board of trustees composed of the director of the CDC and 14 members appointed by the governor. The original bill sought to advance the recommendations of the Blue Ribbon Commission. Proponents of the bill noted that the amended version proposes a smaller, more incremental approach that has been vetted by public health stakeholders. Proponents stated that the bill puts forth a reasonable, forward-looking and evidence-based approach to strengthening public health. Also, proponents stated legislators are tasked with addressing complex issues related to public health, but Maine does not have a sustained structure to provide independent expertise. The commission proposed in the amendment could provide that source. The proposed stabilization account will stabilize Fund for Healthy Maine funding. There were some recommendations to add additional positions to the commission, including MD and DO professional associations, the folks representing the interests of older adults, and folks representing Alzheimer's and dementia programs. DHHS testified that they opposed the bill both as originally drafted in the amendment. As regards the original bill, they stated that the bill would shift fiscal authority away from the legislature to an unelected body. The legislature is constitutionally empowered to oversee state revenues and expenditures and to pass a biennial budget. Also, the flexibility to allocate Fund for Healthy Maine funds to the legislature has enabled Maine to respond rapidly to public health needs. As regards the proposed amendment, the DHHS stated that the new Commission on Public Health Prevention will assist the provision stating that the new Commission on Public Health Prevention will assist the Maine CDC in the development of a plan is duplicative. This collaboration already exists through the statewide coordinating councils, which help to develop the State Health Improvement Plan, which was most recently updated in 2024. They are still working to determine the impact of the proposed stabilization fund. There's a concern that any change to baseline funding for Maine Care could reduce federal match. There was also neither for nor against testimony that referenced the statewide coordinating councils for public health and suggested using those for the duties that this bill would give to the new commission. We already went over the background for the master settlement agreement and prior legislation, so let me just get into what this bill does. I'm on page 4 under potential issues, technical problems, issues for consideration. So as originally drafted, again, this bill is very similar to LD 1523 and LD 1693 and the 130th. I included my old bill analysis for those bills because it was like really long, but I didn't get into all those issues here. I'm happy to go over any of those issues if you want, but I did focus mainly on the amendment that is in front of you because that is what folks were commenting on. In the original bill, there's some concerns about the transfer of spending power to an entity outside of the legislature. There's also, as you may recall, some concern over the use of the term trust and legally what that means. The amendment, I don't think presents either of those issues. It replaces the original bill in full. It establishes the Fund for a Healthy Maine Stabilization Fund as a sub-account of the Fund for Healthy Maine. It requires the state controller to credit all participating manufacturer adjustments received for 26 and 27, 10% of non-participating manufacturer adjustments for 28 and thereafter, and a proportional share of interest or other investment income on balances in the Fund for Healthy Maine. It provides that funds shall be used to support the work of the Maine Commission on Public Health and Prevention, support development and promotion of a comprehensive state plan, and eliminate the need for a working capital advance. If the need for a working capital advance or use of settlement payments in the fiscal year in which they are received is not eliminated by April 28, any funds in the stabilization fund remaining in subsequent years may be used to reduce reliance on those two sources until all settlement payments can be allocated to the fiscal year following the year in which they are received. I know this is a lot. We'll slow it down and go through that with Carol, I believe. Any remaining funds may be used for health promotion activities available within the Fund for Healthy Maine and may not be transferred out of the Fund for Healthy Maine. So that's the stabilization account. The second thing that this bill proposes to do is to establish the Maine Commission on Public Health and Prevention. The purpose of that commission would be to assist and advise the legislature on matters involving public health and prevention and assist the Maine CDC with the development, publication, and promotion of a state health plan. The commission is funded by the Stabilization Fund and overseen by the Joint Standing Committee of the legislature with jurisdiction over matters related to public health. So if you choose to move forward with the commission, there's some things you always think about when you're establishing a new, what's called public instrumentality. There's a attached document that I have that walks you through kind of some questions when you're creating a new commission, an entity that is non-governmental or quasi-governmental. So we can go through that if you wish. They're just kind of a brainstorming chart. Also, you want to think about the relationship of LD 1658 to this bill. They can work together. They can also work separately. So I think it's good to think about how one impacts the other. I believe Carol can help explain that. But they do stand alone. So you have, again, some resources. You have the final report for the Fund for Healthy Maine, executive summary. You've got 22 MRSA section 1511, which is the Fund for Healthy Maine statute. You've got the status report for the Fund for Healthy Maine, and you have the language that goes through the public instrumentality questions. You also have, and this came yesterday, a letter from HCIFS, which is related but not directly related to this bill, but I'll bring it up now. So HCIFS went over a report that they had received on a study, the commission to evaluate the scope of regulatory review and oversight over healthcare transactions that impact the delivery of healthcare services in the state. We really like long titles for studies. So HCIFS is asking that HHS look over their recommendations. So they're looking specifically at legislation that would reinstate the state health plan, which is distinct from the state health improvement plan, which is what currently exists and has to do that the CDC manages with the statewide coordinating councils and has to do with community needs and health access. The state health plan that is being proposed by HCIFS is, I believe, a reinvigoration of a process that used to exist that was eliminated sometime in the past administration. And it focuses largely on affordability as opposed to the lens of the CDC health plan, which is more public health related. So you have this, you can do whatever you wish with it. I just wanted to bring it to your attention. And I believe we do have folks who can get into some more of the details of the financial aspect of this if you wish.
Any questions for Sam? Thank you, Sam. I am, along with some other committee members, I'm sure not inclined to support the Maine Commission part of this amendment. I think what I'd like to focus on that comes from the amendment is this first part, which is the stabilization fund. And I know committee members are eager to get some more clear information on this so that we can understand it. And for that, I'd like to call up, there's a great expert in the room, Carol Kelly from the Maine Public Health Association. Thank you.
Thank you, Senator.
Introduce yourself.
Members of the committee, nice to be
Yeah.
here.
So Carol's going to talk about this stabilization account that's proposed in the amendment a little bit to give us a clear understanding of what it is and how it's different than what we already have, if you would.
Sure, I'll
Thank
do
you so
my
much.
best, and I will say that this is complicated, or at least got many moving parts. I don't know if it's complicated, but it's not easy to describe. So I will do my best, but I hope you'll ask questions liberally if I don't cover it sufficiently.
Don't forget to introduce
the-
yourself. Introduce yourself
Oh,
completely.
I'm so sorry. Carol Kelly. I'm a public health consultant. And as Senator Ingerson said, I've been working with the Maine Public Health Association for quite a few years to support and stabilize the Fund for Healthy Maine. And so this bill is an important component in that effort. So I will just start, I will try to cover this concisely. And relatively swiftly. So again, ask me anything when I get done. And I'll do the best I can. The Fund for Healthy Maine payments are a combination. The Fund for Healthy Maine is a combination of revenue streams. And so we have the master settlement, the tobacco settlement, which was established in 1998. We've got Racino, a portion of Racino funds that are received every year. And now we have the new, the new tribal gaming receipts, which is another $200,000 a year. So there's three current revenue streams in the Fund for Healthy Maine. If LD 1658 passes, that would make a fourth and very critical one, which would be a portion of our tobacco tax, excise tax payments. So this is a good solid combination. The master settlement payments are received in two separate payments. One portion of the master settlement is received every April, and it is a fairly predictable. We know when it's going to arrive, and we can generally predict how much it's going to be. Unfortunately, as you've heard, and I won't repeat, it is a declining revenue stream because of the switch from cigarettes to vaping and pouches and the other products that aren't part of the settlement from 1998. So we're seeing a general decline or a trend line of decline in the master settlement or tobacco settlement payments. So April payments are a piece of that. There's also a separate payment, which is we call a disputed payment, but the manufacturers are allowed to dispute a portion of the payments that they are required to pay to make sure that states are enforcing the master settlement appropriately. Those disputed payments don't come in at a scheduled time. And while we generally have a pretty good idea of how much they'll be, there is some fluctuation there as well. So they are not allocated in the budget until they are received because they aren't 100% predictable. So you'll see on the OFPR documents, it's a footnote, it's an asterisked footnote of this doesn't include the disputed payments. So when you all passed the budget for the current biennium, you resolved the structural deficit in the Fund for Healthy Maine with a transfer from the general fund. You did not use or allocate the dispute payments because they hadn't been received yet for 26 and 27. That means those two payments, which will hopefully hit the mark and total about $25 million, are going to come in. And this is the opportunity to use those 2 years of unallocated dispute payments to create a stabilization fund in the Fund for Healthy Maine, which I think we could say now, maybe more than ever, is it going to be a really helpful thing for the future, for future planning. So the reason I say that is twofold. One is the current environment, and the other is that the Fund for Healthy Maine operates on a loan. And I think this is fairly unusual, though I haven't researched if it happens in other funds. The Fund for Healthy Maine programs are paid by a working capital advance from the general fund for the first 9 months until that April payment is received. And in April, when the tobacco settlement payment is received, that one that we can predict, it pays back the 9 months of the working capital advance, and then the remainder is used on the final 3 months of the fiscal year. That is not a lot of leeway if things take a downturn, or let's just say there's a change of heart in a new administration or in any way where suddenly the Fund for Healthy Maine and those programs are not, either we're not receiving the funds that we predict, or that something changes in the political wins, let's say. So we have 3 months. When that April payment comes in, we basically have 3 months left. If we take these 2 dispute payments from fiscal year 26 and 27, put them into a stabilization account, which is a sub-account, as Sam said. So it's not outside the Fund for Healthy Maine. It's just a sub-account in the Fund for Healthy Maine. If we take those 2 dispute payments and we put them into a stabilization account, and we start to take a portion of each dispute payment received after that. So we designated 10%, which is about $1.3 million a year, that would start flowing into this savings account. We would get to a place where we could buy our way out of, if you will, the need for a working capital advance. The objective is to get to a place where every April, the money that comes in is used the next year, not to pay back a loan that was taken on the current programs. And that just strikes me as good fiscal policy and prudent use of resources. So I hope that was helpful without going on and on.
No, thank you. Any questions? Senator Moore?
Carol, thank you for simplifying that like that. To try to read that, wasn't coming out with that. So the funds that we get in April, are those considered allocated funds? Are those also non-allocated?
Those are allocated.
They are allocated. Okay. So it's just the disputed funds that become in as non-allocated.
Exactly.
Okay, gotcha. And those could be grabbed and used for whatever. Gotcha.
You've seen it many times before.
Yes, we have. Yes, we have, depending on who's in charge. Yeah, exactly. Thank you.
You're welcome.
So we're taking 2 years worth of disputed funds to establish this fund. And then in future years, a percentage, which you said was 10%,
10%, yes.
of future disputed funds. And that's
Correct.
exactly where the money comes from for the stabilization.
Exactly.
Okay.
So it's not 10% of all payments. It's just the disputed payments, which is unallocated
Right.
Until it's received.
So this isn't going to be in the future possibly fully what that Fund for Healthy Maine needs. It's just to be money to be used if needed.
That's correct, Senator. And I did a quick back of the envelope on how we get to a final full payoff of the working capital advance. The 25 million. So right now, the Fund for Healthy Maine receives about 20.6 million from the master settlement from the April payments. Quite a drop from the early days. 20.6 million comes in April, and then another 12.8 is estimated to come in these annual dispute payments at the current time. So that's about 33.4 million. If we can get 25 million into this savings account, into this stabilization account, that gets us it's pretty close to the 9 months, right? So that means every payment after that in April can at least be used in the forward-looking way and not looking back. But what this bill is structured to do is to take that 10% and keep using it to buy down, buy down, buy down. It could take up to 6, 7, maybe even 8 years to fully buy down the loan. But it would be really great to get to, or I shouldn't say the loan, to fully get us ahead to the point where the April payment is used in the next fiscal year.
Any further questions, Senator Moore?
And this may be more even of a question too. It still requires, if we are going to use the Fund for Healthy Maine for any, that would be approved by the legislature, correct? For any events.
Absolutely. And I would take it a step further. It requires that the money never leave the Fund for Healthy Maine. It is a sub-account within the Fund for Healthy Maine. And so everything that you all decide.
Asking for.
Yes.
Yeah.
Yeah,
Okay.
exactly.
Thank you.
Further questions, clarification needed? Michelle or Senator Meyer?
Representative.
I forgot.
Thank you. Appreciate
You're
that.
welcome.
Thank you for being here. So I am disinclined to support any other aspect of the amended language other than the sub-account, the stabilization portion of this amendment. Also disinclined to further amend what I can support with language around a state health plan, which was what HCIFS had indicated they thought this might be a vehicle for. it may be a fabulous idea, but I would not be inclined to include that here. And if that's clear enough from me for a motion, I would move to pass as amended, as I just articulated.
I'll second the
And second,
motion.
that. Senator Moore seconded. Okay. And do you have a question, Sam? Did you have a question? Okay. Given that, we have a motion on the floor in a second. Are we ready for a vote? All those in favor?
Thank you.
Thank you very much.
Thank you so much. Thanks so
I
much.
will need to do some.
Yes.
Some work on this to make sure that I'm removing, references to the,
Commission, the health.
Yep. Yep.
The health plan.
Yep. Yep.
And then we're not even considering the HCIFS
Yep.
recommendation.
So I will bring back language.
Thank you.
to look at.
Appreciate
Thank
that.
you.
That's a
Yeah.
good reminder to everyone is that we will get to review the language modification.
Yeah.
So that if there's any tweaking that has to be done, we can definitely do it at that time. Thank you.
Absolutely, great. Okay, with that, I will close the work session portion for this morning and see you all at 1 o'clock for the hearings. Good afternoon. Welcome to the Health and Human Services Committee, everybody. I'm Senator Henry Ingwerson. I'll be chairing today's proceedings, and I'm going to have introductions starting over to my left with Representative Levelin.
Hi, I'm Michael Lemlin. I represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Good afternoon. I'm Representative Dan Shigori. I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
Good afternoon. I'm Tim Nangle. I'm the one having trouble with my button. I represent Senate District 26, which is Wyndham, Raymond, Casco, Fry Island, and the better parts of Westbrook.
Good afternoon. I am Representative Lucian Daigle. I represent House District 1, the extreme northern part of Maine, and it's not warm.
Hello, good afternoon. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Thank you for joining us. I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair.
And I'm Senator Henry Ingwerson. I represent Senate District 32, which is the city of Biddeford and the towns of Arundel, Dayton, Hollis, and Lyman. And I'm pleased to be the Senate Chair of this committee. I'll be presiding over the public hearings today. The purpose of the hearing is to invite testimony from members of the public regarding proposed legislation before this committee. Today, the following bills are scheduled for public hearing in this order: LD 1414, an act to support and sustain Maine's child care workforce, and then LD 2066, an act to establish a child care employment award. The committee will hear testimony from people present and on Zoom who wish to speak for, against, or neither for nor against the bills being heard today. With the leave of the chair, committee members may ask clarifying questions of the person testifying today. The public hearing is just for that, for the public. The committee will have time for deliberation and debate at the work session that will be scheduled in the next few weeks. I'd like to also welcome our committee clerk, Sophie Dubé. We'll be taking testimony from people in the room and on Zoom in the following order: those in support of the bill, those opposed, and those neither for nor against. This committee will give members of the public priority when taking testimony. Only the bill sponsor and co-sponsors will be recognized before the public. We do run a 3-minute clock here on testimony. You'll see the clock on the front of the horseshoe. As you are approaching the 3-minute point, please wrap your testimony up. And kindly, I have a suggestion. If you notice that the testimony before you has hit on those main points you want to say, and there's other things you want to say that might still pull you into the 3 minutes, try doing that. It's very, very helpful to us as a committee. If you have prepared testimony, please provide 20 copies to our clerk. You may leave those copies at the end of the podium here to my left, end of the horseshoe, excuse me. Please sign in at the podium, and we thank you for joining us today. What's that?
Anna Broom.
Oh, yes. Our analyst is also here today. Anna Broom, welcome. Whether or not you do testify, you can submit written testimony to this committee. Please be mindful that testimony is public and available to all once presented. This hearing is live streamed and there's a recording of the meeting. Please silence all your electronic devices. If you're on Zoom, please make sure we're able to identify you when we're ready to take testimony from those attending virtually. If you're having any technical difficulties, please call our clerk, Sophie, at 207-287-1317. Some of our committee members serve on other committees today and may be coming and going. You may also see committee members eating and drinking at the horseshoe. The public is not permitted to eat and drink in the committee room. I'm going to ask newly arriving committee member to introduce himself, and then we'll start in on the first bill.
Thank you, Senator. Forgive my tardiness. My name is Sam Zager, honored to represent District 116, which is part of Portland.
Yes, good afternoon. I'm Representative Annie Graham. I serve the people of North Yarmouth and majority of Gray, House District 105. I serve on another committee, so I apologize for being late.
Thank you. And with that, we'll introduce our first bill, LD 1414, an act to support and sustain Maine's child care workforce, presented today by the bill sponsor, Senate President Daughtry. Welcome.
Thank you.
Not running,
What's that?
not running, a
We won't run the clock for the bill sponsor. Hi.
Hello. Good afternoon. Senator Ingerson, Representative Meyer, and esteemed members of the Joint Standing Committee on Health and Human Services. I think this is a Wednesday that feels like a Monday for all of us. But I'm grateful to be here with all of you. My name is Maddie Daughtry, and I serve as the president of the Maine State Senate, proudly representing Senate District 3, including Brunswick, Freeport, Harpswell, Pownell, Shebag Island, and part of Yarmouth. And I'm honored to present LD 1414, an act to support and sustain Maine's child care workforce. This bill is in direct response to what I heard and witnessed firsthand while on my Support Kids, Support Maine statewide child care listening tour. This summer and fall, we traveled across the state to learn what's working and what's not working in Maine's childcare system. We decided to do the bill a little bit differently and start with listening and then come up with a solution. My team and I visited 11 early childhood programs across 6 counties, including in-home family childcare programs, Head Start classrooms, nonprofit and center-based programs, and innovative intergenerational models. In addition to those visits, nearly 200 parents and educators shared their experiences through our statewide survey and virtual listening sessions. While there is real optimism about recent legislative investments, and I thank this committee for their bold action on those, there is also a clear and consistent message. Our childcare workforce remains stretched thin, undersupported, and at risk of collapse without sustained action. One of the most urgent needs that we heard about across geography, program type, and income level was the crisis in infant and toddler care. Providers were candid that caring for our youngest Maine children is the most expensive, labor-intensive part of their operation, and yet it is often the least financially viable. In rural communities and childcare deserts in particular, families are waiting months or even years for infant slots. And some programs have stopped serving infants entirely because the math simply does not work. As we develop this legislation, I work closely with early childhood educators, advocates, and members of this committee to balance what we heard on the tour with what would be most immediately helpful and administrative workable for providers. Based on that feedback, I am bringing forward an amendment to LD 1414. In the interest of supporting the childcare community in the manner most efficient for them, I have worked with the committee to amend the text provided. This change will strike sections 1 and 2, and in their place will be language that increases the existing Child Care Assistance Program, CCAB, base rate to a bump for infant and toddler care from 10% to 20%. This change targets funding where costs are highest and access is the most limited, helping programs cover the true cost of care for our youngest children while supporting families who rely on the CCAP to stay in the workforce. Throughout the tour, we heard repeatedly from programs serving parents who work non-traditional hours, like legislators, including healthcare workers, hospitality employees, and manufacturing staff. Throughout the Child Care Listening Tour survey, parents describe the challenges of finding care that aligns with their work schedules. These families often have the least flexibility and the fewest childcare options, yet they are essential to our local economies and communities. And at the same time, childcare providers reminded us that they themselves are small business owners, navigating razor-thin margins, the thinnest of thin margins, while trying to do right by their staff and their families. Center directors talk candidly about the complexity of business planning, especially when considering expansion into off-hours care. Even when the demand is there, with the upfront costs, staffing challenges, and financial risk can make these transitions nearly impossible without targeted support. That is why LD 1414 also establishes a grant program to help child care providers plan and transition towards off-hours care. This program is designed to support directors with technical assistance and resources needed to make thoughtful, sustainable decisions, not just to expand care to be more inclusive of different work fields, but to do so in a community-driven way that truly protects the quality and workforce stability of centers. Childcare that matches the 24-hour work schedule is an absolute necessity for our hospitality industry and medical fields, and this bill and grant program aim to help childcare center directors navigate the complicated business planning that goes into transitioning to this type of care. And I want to be clear that none of this work happens without the dedication of early childhood educators and advocates across the state. Programs like Head Start, intergenerational centers, and community-based providers are holding our system together through creativity, resilience, and sheer commitment. And often that comes at a personal cost. CCAP remains one of the most critical tools we have to ensure access, equity, and workforce participation. Strengthening it is foundational to any long-term solution. And the focus of another bill I look forward to presenting to this committee later this session. If the committee will indulge me for just a quick moment, because this work is deeply interconnected, I also want to highlight the importance of LD 2066, sponsored by your own Senator Ingerson. His bill recognizes a simple but powerful truth we heard again and again on the listening tour. Early educators cannot afford to work in the very system they sustain. By establishing the Child Care Employment Award, LD 2066 would provide childcare subsidies directly to licensed childcare facilities and family childcare providers on behalf of their employees, ensuring that educators can access affordable care for their own children while remaining in the workforce. The bill also makes thoughtful investments in program administration and long-term sustainability. Together, these bills reflect a shared commitment to stabilizing the workforce, reducing turnover, and honoring early educators as both professionals and as parents. As I mentioned, I've worked directly with the early educator community in developing this bill, members of the Right from the Start Coalition, and educators whom we met. And they will also, many of them, be supporting in today, testifying in support today or sending in testimony as well. And we'll be able to speak in more details about the on-the-ground impacts and implementation considerations, as well to answer any questions that I may not be able to. I truly appreciate the committee's time and thoughtful consideration. I urge you to support LD 1414 as amended. And I just want to add that it has been a bipartisan effort, not only of your committee, but of this legislature to support this type of work. We have some very hard financial decisions ahead of us. I think one of the, as you're considering bills like this and others, whatever we can do to recognize that this is a complicated ecosystem, and our commitment needs to be what we can do to make sure this care is available for the kids first and foremost. So I look forward to continuing to work with all of you.
Thank you, President Daughtry, for bringing this bill forward to us today.
Of course.
Appreciate it. Do we have any questions? Yes, Representative Graham.
Thank you. Thank you, President Daughtry. It's nice to see you.
Nice to see you.
In person.
Yeah. Not just a voice down at the end of the hall.
Well, or on the, but anyway, help us better explain or understand the rate bump for infant and toddlers from 10 to 20%. And to that point is my understanding that in childcare ratios need to be much tighter for that age group. So can you kind of help us and people who are listening understand why this percentage needs to happen?
Yes, so definitely want to highlight that there'll be providers who work in this firsthand, and also center owners and family care owners who are dealing with this cost and with this decision-making process, but they have a lower ratio than older kiddos, and also to some of the most expensive intensive care to provide. I mean, think about your own family members, your children, your grandchildren, your nieces and your nephews. We've all been there, and we know that our youngest folks are sometimes, need the most. You can't leave an infant with a book in the corner. We're talking very intensive care. And because it's so intensive, it is more expensive. And this is why a lot of places are having to close their infant and toddler rooms, because they have a lower ratio and it's near impossible to make the balance sheet work. So the idea was, we were in areas, I think it was Searsport, and I do need to confirm it was this area, but they were talking about they're concerned about facing an infant and toddler desert because there's just not enough areas. And in every place we went to, we heard from not only providers, but from parents who are picking their jobs or where they're going based on where they can find that infant and toddler care. And folks are having to drive further. There's less and less centers, and we need to do everything. We've made historic investments, but this is also recognizing that in that ecosystem of childcare, before folks are entering, our education, our full, public pre-K system, that we have a real problem for, small children. And I know just anecdotally amongst my own friends and family members, many folks, even in my own office, have had to leave the workforce to be able to take care of an infant or a toddler. So.
Any further questions? Yes, Senator Nangle.
Thank you for being here and presenting this. Can we count on any federal money for help for this?
have to get back to you on that answer. But I would hope if anyone's listening, I think regardless of who you are, where you are in this country, I think one of the most amazing things we have is our education system and our childcare. We see incredible data of like return on investment, if you want to get technical, of every dollar we invest in our kiddos prepares them to enter preschool in a much better, they're developing, this is not babysitting. This is developing neural pathways for those fine motor skills so that when a student gets to preschool, they know how to pick up that crayon. I mean, I was sitting at a table in the Lewiston Auburn area at Clover, and the kids were starting, fighting over scissors, and one stole another's glue, and I'm sitting at the table with them doing art, and one's crying and another can't figure out how to hold up the scissors. And if you look at that, you might just think, oh, what a sweet moment. But I was talking to this incredible educator there about here's what's actually happening in that moment. Not only are they learning interconnected social, emotional learning, they're figuring out how they hold the scissors. They're figuring out how they're tearing the paper. These things that get to the point where all of you are able to look at the bill in front of you and take notes. And, even if we might not be able to get federal funding, which I hope we could, this is something that I hope all Mainers and all Americans recognize is, frankly, the best investment we can make. Sorry, that was a very large soapbox, but if you get a chance to visit centers, I really recommend, if you have a family care program, these are really innovative, uplifting places. So.
Any further questions? Thank you so much.
You guys are letting me off easy. Thank you.
Now I have a sign up list, so I'll just go in order here. First up will be Charlotte Jacobs. And on deck will be Chantel Pettengill.
Good afternoon, Senator Ingwersen, Representative Myers, and distinguished members of the committee. My name is Charlotte Jacobs. I'm a parent, a child care provider, and a community organizer. I'm here today on behalf of Maine People's Alliance and its more than 32,000 members, an organization committed to creating a world where everyone has what they need, everyone contributes what they can, and no one's left behind. I'm testifying in strong support of LD 1414 and LD 2066, two bills that must move forward together if Maine is serious about stabilizing and rebuilding its childcare system. I've worked in Maine's early childhood field since 2011. Entering the workforce as a young mother, I have explored various options and found the only financial sustainable path was working at a childcare center where my child attended, receiving a discounted tuition. To put this into context, in 2011, with a 50% discount, I paid $92.50 per week for care for my 18-month-old, and that was 4 days a week, not 5, because dropping a day was a way to save a little money. Families and educators are still making these same calculations today, but costs have grown far faster than wages or supports. That's why these two bills really matter for long wait lists and workforce supports. Even in Gorham, where families earn middle to upper incomes, the cost of full-time childcare is a serious challenge. Since the CCAP expansion, families who would not normally qualify for assistance are finding without support, paying for childcare is nearly impossible. Childcare is now a financial burden for families across all income levels. Between two locations of the childcare centers I work at, out of 40 staff members, 20 with children, only 2 have been able to access the employment award for childcare workers. Maine needs to catch up with historic investments in childcare. Right now, we are falling behind other states in funding levels, while states across the country are making history with transformative investments that expand access for all families. If Maine wants a childcare system that works for educators, children, and families alike, we can't keep falling behind, and we must act now. Together, LD 1414 and LD 2066 support Maine's childcare system by ensuring that when funding flows to families and programs, there's a qualified, stable workforce ready to deliver care. These bills in tandem work to help recruit and retain experienced childcare educators by making the profession financially viable, supports program stability by reducing staff turnover and burnout, and stabilizes enrollment by ensuring families can afford care and programs can operate at full capacity. I urge the committee to support both bills to continuing investing in solutions that allow childcare professionals to remain in the field and ensuring families can access affordable, high-quality care. Thank you for your consideration.
Thank you so much for coming. Do you have any questions for Charlotte? Seeing none. Thank you. Chantel Pettingill. And then Sam Zuckerman.
Good afternoon, Chairman and Chairwoman and distinguished members of the Health and Human Service Committee. My name is Chantel Pettingill. I'm the owner of Pettingill Academy and a resident of Monmouth. We are a large childcare provider serving the communities of Lewiston for the past 14 years, Brunswick for 3, and Auburn for 1. I'm also a certified teacher in the state of Maine and a childcare business coach with the Childcare Success Academy, where I work with childcare owners across the United States, Canada, and the UK. I'm going to shift a little bit just because of the amendment, but across our 3 schools, we're licensed for 484 children and currently employed an average of 80 teachers and administrators. And I'm here in support of LD 1414. With the amendment of the increase for childcare subsidy would help us greatly. In my next testimony, I do have numbers that will help support of why that increase is definitely needed. With that. But regarding the overnight care grant, I don't have a strong opinion one way or another. Our centers have explored overnight care in the past, and we have found it not enough sufficient demand to cover the high cost of overnight operations. From my perspective, those funds may be better used to expand access to the Child Care Affordability Program and reduce the wait list of families that have been sitting on it for the past 12 to 18 months waiting for childcare. In closing, LD 1414 allows childcare programs to support the workforce while protecting families from tuition increases. It's a practical solution that strengthens childcare programs, stabilizes staffing, and supports Maine working families. Thank you for your time and consideration.
Thank you for testifying today. Do we have any questions for Chantel? Seeing none. Thank you. Sam Zuckerman and then Bill, I think it's Bill Hayes, maybe? I hope I'm right.
I got
Welcome, Sam.
Thank you. Good afternoon, Senator Ingwerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Sam Zuckerman. I am the Policy Coordinator of the Permanent Commission on the Status of Racial, Indigenous, and Tribal Populations. I am here today on behalf of the Permanent Commission's Policy Committee to testify in support of LD 1414, an act to support and sustain Maine's childcare workforce, and LD 2066, an act to establish the Child Care Employment Award. I figured I'd do both at once to save y'all some time. Maine is in the midst of a childcare crisis. High costs and lack of services leave many families or hopeful future families with no options. This is especially true for families of color. At the same time, childcare providers are increasingly struggling to make ends meet and to retain staff. These bills would be an important step towards further stabilizing the childcare industry and ensuring that every family who needs childcare has access to it by both providing support to families in making childcare more affordable and in providing incentives to childcare workers, ensuring that there are enough workers to provide these much needed services. Childcare in Maine costs an average of 20% of a family's annual income. The average cost per child is $12,500, but can be as high as $19,000. This disproportionately impacts Maine families of color, whose median income is significantly lower than that of white families. People of color in Maine are also much more likely to have irregular work schedules than white Mainers, creating further challenges to getting the care they need. Lack of access to childcare ultimately impacts us all. In 2023, the primary reason that 22,000 Mainers were not working was a lack of childcare. Nationally, people of color are more likely to have lack of childcare prevent them from working. 28% of Latino women and 28% of Black women report taking unpaid leave to provide childcare compared to 12% of white women. Interruptions in a person's ability to work can then impact their economic stability and their career trajectory, and ultimately can deepen racial disparities related to wealth and income. Thank you for your time and attention. We urge you to pass this bill. I'd be happy to answer any questions.
Thank you for your testimony today, Sam.
Yeah.
Do you have any questions for Sam Zuckerman? Seeing none.
Thank you very much.
You're welcome. Bill Hayes and then Eleanor Higgins.
Good day. I apologize for my bad handwriting. My name is Bill Hager. I am resident of beautiful downtown Wells, Maine, and I work for Catholic Charities, overseeing their two childcare programs, one in Biddeford, one in Portland. And we were very happy to host Senator Ingerson and Senator Daughtry for their tour this year. I'm here in favor to speak in favor of LD 1414. We love this thing. Let me start by saying thank you for the work you did the last two sessions on childcare funding. I really feel validated. I've been coming up here yammering at people about childcare for longer than most of my staff have been alive. Truly, 50 years. We would love to have this legislation package continue this trend because we're not there yet. I can also tell you from long experience that when childcare had been expanded in Maine, when more options became available, it was a direct result of an increased investment of public funds. I can cite, I won't do it right now, but I can cite any number of times when we've come here, we've been successful in childcare, especially infant toddler care. Last time we saw a major increase was some 25 years ago with Start Me Right. And we saw a investment in infant toddler care of state funds, and it took off. It wasn't sustained, but it did take off. It did make a difference. Speaking specifically to infant toddler care, two issues on that. One is that the cost of care is higher. And I want to be careful if I say this, is that we do not disagree with the higher standards for infant toddler care. It's a 4-to-1 ratio as compared to a 10-to-1 ratio for preschool care. You need that higher ratio. Again, I've been doing this for a really long time. It is not safe to have more than 4 babies in a room with a staff person. Babies don't stay babies very long, and they have all the, at 1 year old, you have all the ability to do everything and no brain cells to stop you. So we don't disagree. However, we do that program through Catholic Charities because we're mission driven, but it is a bad business decision. If I could double my enrollment by doing only preschoolers, business says I should do that. Community says, no, we need this. Point I skipped over, but I'm going to come back to real quickly, is that the cost of living, as we know, has increased, but it has been increasing steadily since the mid-1970s, so that the option of staying home with a new baby does not exist anymore. The livable wage in Maine has increased so much, which is how much it takes just to survive. Rent, transportation, education, food. One income will not cover it. And now we can't wait, and families can't wait until they're 3 because they can't take the 2 years off. They can't afford it. I'm going to state 3 things I'd like you to keep in mind. The first is that we as providers share the goal of many people in this room about parents working. We want parents to work. We just don't want to sacrifice the well-being of the child so parents can work. The second piece is this funding going through what we call the Child Care Affordability Program. That program is specifically not for welfare families. I said this a year ago. I said it 2 years ago. You folks probably get more input about why aren't you helping me? I'm not on welfare than any other thing you hear. The CCAP is not for welfare families. It's for families who are making too much for welfare, but not enough to afford good quality care. Last point is that it makes a difference. There is no better return on investment than paying and helping small children. I want to also speak to Senator Nangel's question. The bulk of the money for the Child Care Affordability Program does come from the feds. However, it's a subset of the Welfare Reform Act. So it is only concerned with paying the least amount and getting the greatest number of people into the workforce. So any incentives that go in to either increase the amount of childcare or the incentive to increase the quality of childcare has to be done by state funds. The federal government doesn't allow that. So I'm done. My 3 minutes are up. I have to answer any questions.
Thank you for being here. It's good to see you again, Bill.
My pleasure.
Do we have any questions for Mr. Zager? Seeing none. Thank you. Eleanor Higgins and then Kim Russell.
Senator Ingerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Eleanor Higgins. I'm a resident of Portland, and I'm the Executive Director of Maine's Permanent Commission on the Status of Women, which is part of the Department of Secretary of State. The commission is a government-appointed group created in statute to improve opportunities and life outcomes for women and girls across Maine. And the commission produces biennial reports on the status of women and girls and advises the governor and members of the legislature about policy and social issues affecting women across Maine. Today, I am speaking on behalf of the commission and its Policy and Legislation Committee in support of LD 1414. Childcare has long been a priority for the commission, both because of its role in supporting better economic outcomes for Maine women and Maine families, but also because of the predominantly female workforce that provides education and care for Maine children. In December 2024, the Commission released a report on Maine women's labor and economic security. And in that report, we celebrated several significant state investments mentioned here today, aimed at bolstering the childcare workforce and childcare providers while also improving affordability for families. However, the Commission's findings also highlighted ongoing challenges. Maine women are more likely than Maine men to cite childcare issues as a barrier to full-time work. In 2024, we've talked a lot about the high costs of infant toddler care. In 2024, just as an example, the average annual cost of center-based childcare for an infant in Maine reached almost $16,000, which is a high number. The high cost of care is one key driver of Maine women dropping out of the workforce or opting for part-time work, a reality that has lasting economic impacts across the lifespan if a woman drops out of the workforce and isn't paying into Social Security accounts or other retirement savings. All counties in Maine face a gap between available childcare services and the number of children that need care. And we know that a 2023 study from the Council for a Strong America found that the lack of reliable care for working parents of children under 3, so that infant and toddler age range, cost the state as much as $403 million annually. LD 1414 would aim to address core affordability challenges for businesses that provide infant and toddler care, something that's good for families and good for those businesses. LD 1414 also includes that funding for planning grant program aimed to bolster non-traditional hour childcare. In May 2024, Governor Mills signed an executive order aimed at increasing women's employment in construction and trades careers. And the commission worked with the Maine Department of Labor to interview and hold focus groups with women across the state employed in construction, engineering, and the trades. One of the major concerns that we heard through those conversations was the lack of available care during the hours of a typical construction workday. And I'll leave you with one quote from a parent who had been experiencing this on a temporary job site. She said, "You might be somewhere for a month or two, an hour and a half away from home, and you have to be there at 6:30 a.m. Meanwhile, your daycare doesn't open till 9 a.m. So I think that highlights it. I see I'm out of time, and the Maine Permanent Commission on the Status of Women is in support of LD 1414. Thank you for your time.
Thank you so much for your testimony, Eleanor. It's good to see you. Do we have any questions? Seeing none.
Thank you.
Just a note, the sign-up sheet for the next bill, LD 2066, is back out there if you want to sign up. And I'd like, we have a committee member joining us. You'd like to introduce yourself.
Thank you. Thank you. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County. I apologize for not being here at the beginning of it. I was actually presenting a bill in state and local government. So thank you.
And come on up,
Hi.
Kim. Hi.
Senator and members of the committee, I'd like to ask your indulgence. I want to defer my position to April, who is here and has a little boy who's getting a little restless. So I'm
great.
happy to go after her, or I'm happy to defer to the end of the line.
We'll get April up here and then you can come right back. But thank you for giving her front line.
It's a little hyperactive. He's running up that hall.
Thank you, everyone, for hearing us today. My name is April Tardif, and I live in Old Orchard Beach, Maine. I'm here today as a working parent, a community advocate, and a Maine State Parent Ambassador to speak in support of LD 1414 and why it matters not just to families, but to Maine workforce and economy. Right now, too many families are falling through the gap in our childcare system, the lack of care during evenings, weekends, and non-traditional work hours. Since becoming a parent, I have struggled to find available quality childcare, especially care that meets my son's needs. He is a wonderful, complex child who needs extra supports since he was very young. Traditional childcare settings were not successful for him, and finding appropriate care has already been challenging. When you add work schedules out of typical 9 to 5 and after 5 p.m., Fridays and weekends, it becomes nearly impossible. In our household, we plan our work schedules weeks in advance. I spend hours calling providers, coordinating care, rearranging shifts, and asking for help just to make sure my husband and I can meet our job requirements. Most of our vacation and sick time isn't used for rest or emergencies. It's actually used to cover childcare gaps when care simply isn't available. There have been many times when my husband has had to take unpaid time off work so that I could do mine, not because we wanted to, but because there was no safe, appropriate option for our child. This is not just a family issue, it is a workforce issue. Maine depends on workers in healthcare, hospitality, manufacturing, and service industries, jobs that require evenings, weekends, and early mornings. When childcare doesn't match work schedules, parents are forced to reduce hours, turn down opportunities, or leave the workforce entirely. LD 1414 addresses this reality. By strengthening childcare rates and supporting planning for non-traditional hour care, this bill helps stabilize both families and the workforce. It gives providers the ability to explore flexible hours in a sustainable way and helps parents stay employed, reliable, and financially stable. When childcare works, families can work. When families can work, Maine economy is stronger. LD 14 is a smart, practical step towards aligning childcare with real lives of Maine families. I urge you to support it. Thank you very much.
Thank you for being here today, April.
Thank
Do we
you.
have any questions? Thanks so much.
Thank you. Have a good day.
Yep. And Kim Russell. And then Clara McConnell.
Thank you so much for that indulgence.
Oh, yeah.
Committee, my name is Kim Russell, and I'm pleased to be with you today. I'm speaking to you today as the State Director of Ready Nation and also as the co-leader of the Right from the Start Coalition. Ready Nation is a business leader organization across our state dedicated to building a skilled workforce and a strong economy by promoting evidence-based policy solutions that prepare children to succeed in education and work and in their lives. Since August of 2024, my organization, Ready Nation, has been part of Educate Maine, which is where I am now. I'm testifying in support of LD 1414, a bill to help stabilize our still very fragile Maine childcare sector. I thank Senate President Daughtry for bringing this proposal forward, and I thank her for taking the time this summer and fall to see the workforce up close and personal through her summer and fall tours of our many childcare programs. We appreciate her sponsor's amendment, which now focuses on this proposal on addressing the high cost of infant and toddler care through the current subsidy system. Childcare is critical for Maine's businesses and our economy, in addition to Maine's families and children. We know that if a parent does not have childcare, they cannot go to work. If they lose their childcare, they cannot go to work. If they miss too many days because of childcare gaps, they often leave their job or lose their job permanently. Simply stated, employers need a reliable workforce, and a reliable workforce depends on reliable childcare. Childcare is the workforce behind every other workforce in Maine. Currently, childcare is the hardest to find for parents of infants and toddlers, as you've heard. These are the youngest children who need the most hands-on care and attention. Thus, the adult-to-child ratio is smaller, and the cost to employ childcare providers for our youngest children is steeper. Due to the lack of easily accessible and published data, we don't really know just how many infants and toddlers are currently in childcare programs and how many are on wait lists for childcare. The Office of Child and Family Services Childcare Data Dashboard does show us how many infants and toddlers are in our state subsidy program. And when I looked at that as of September 2025, only 72, less than 2% of the 4,151 children that were participating in the Child Care Affordability Program are in fact infants. If you look at that chart on the data dashboard, in 13 of our 16 counties, less than 10 CCAP-sponsored slots are available for infants. 954, or 23% of the children served by CCAP are toddlers. And we know that CCAP only serves 10% of the eligible population. We also know, according to statistics in the Maine Kids Count data book, that 69% of all children in Maine age 6 and younger have all parents in the workforce. Given that, we have approximately 49,000 children who need care. I'm sorry, I ran out of time. I'm usually not bad at that. I thank you for your consideration, and I urge your support of this bill.
Well, thank you so much for your
Thank
testimony.
you, Senator.
So much.
You just
Sorry,
talk
I'm happy.
slower.
I talk slower. I'm usually
Are there,
not.
do we have any questions?
Thank you.
Thank you so much. Next, we have Clara McConnell and then Adam Good.
Good afternoon, Senator Ingerson, Representative Meyer, and distinguished members of the Health and Human Services Committee. My name is Clara McConnell. I am a government affairs consultant at Main Street Solutions, and I'm here today representing the YMCA Alliance of Northern New England, which includes the 15 YMCAs across Maine. Thank you for the opportunity to speak in support of LD 1414. We understand that the amended version of this bill proposes increasing the child care affordability program subsidy payment for infant and toddler care from 10% of the market rate to 20%. And the YMCAs in Maine fully support this proposal as a timely and important opportunity to address persistent gaps in child care access across our state. As Maine's largest child care provider, we see firsthand how families, especially those with infants and toddlers, are struggling to find stable, affordable care. As you've heard, infant and toddler classrooms require significantly lower staff-to-child ratios, 1 educator for every 4 infants, for instance. And staffing makes up the largest share of a child care program's costs, which means that infant and toddler care costs substantially more to deliver than child care for older children. These costs are rising every year, but the child care affordability payment rates have not kept pace with the true cost of providing care for Maine's youngest children. As more preschool-aged children enroll in public pre-K, which we fully support, private child care programs are losing tuition revenue that has historically helped to offset the higher cost of infant care. So as we continue to grow our public pre-K programs, we also need to continue to invest in care for the younger children as well. Increasing child care affordability program payment rates for infants and toddlers would allow providers to cover staffing costs, retain and attract qualified educators, and maintain safe and high-quality environments for children. And I would just add that while we're fully supportive of this proposal, we also urge the legislature to continue investing overall in CCAP. Currently, nearly 1,000 Maine families are languishing on the CCAP wait list, unable to access vital care for their children. And so we think LD 1414 is an important piece of the puzzle, but it's not the complete solution. And I believe the Senate President has another bill that will deal with CCAP overall. And so thank you, and we urge your support for LD 1414.
Thank you so much for testifying, Clara. Any questions? Seeing none. Thank you. Adam Good and then Katie Gilmore. Welcome.
Good afternoon. Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee. My name is Adam Good. I'm the Legislative and Political Director of the Maine AFL-CIO. We represent 40,000 working people in the state of Maine. We work to improve the lives and working conditions of our members and all working people. We testify in support of LD 1414 and LD 2066. The lack of affordable and accessible childcare is a huge problem for Maine working families. We have surveyed several hundreds of workers around the issues impacting their lives, and childcare continues to be one of the most important. Many workers are living paycheck to paycheck and cannot afford the high cost of care. Others face short-staffed shifts because people cannot stay in their jobs due to the availability of affordable childcare. Still others are deciding not to have children because they cannot see a future with children in which they can make ends meet. For several years, the Maine AFL-CIO has supported efforts to improve our childcare system. For us, the most critical immediate need is to invest in the childcare affordability program, which helps people afford the cost of care, but has had a wait list of over a year. We urge you to make the necessary investments to ensure the CCAP program is accessible to the families who need it. However, we also know how critical it is that the state reimburses providers enough to cover the cost of caring for young children. If the state fails to do so, providers will not offer slots to subsidy-receiving families, and care will be out of reach for working families. That is why we encourage you to support LD 1414. We also recognize that the workers who care for our children are the backbone of the system that we all rely on. In recent years, many of you supported creating the Child Care Employment Award. This program, along with enhanced wage supplements, helped more early childhood educators enter or stay in the field and thereby improve the availability of care. But with funding only secured through the current fiscal year, we urge you to make this program permanent and to fully fund it in the coming year. Failure to do so would result in a significant cut to the benefits for hundreds of childcare workers. We all depend on nurses, firefighters, teachers, and many other essential workers to be able to get to work every day. If they do not have childcare, they cannot do their jobs, and we will all lose. That is why we urge you to support LD 1414 and LD 2066 and to fully fund the childcare affordability program. Happy to take a stab at any questions. Thank you.
Thank you, Adam, for your testimony. Do you have any questions? Yes, go ahead.
Clarifying. Hi, Adam. So the employment award is funded through FY 26?
That's my understanding. Yeah.
Okay. Yeah, I'm seeing. Okay, thank you.
Enjoy the rest of your afternoon.
Katie Gilmore and then Heather Martin.
Good afternoon. My name is Katie Gilmore. I'm a mother of 6 and the owner and director of Laugh and Learn Academy in Holton, where we serve 84 families, 20 of which are infants and toddlers. Because of the low ratios for infant and toddler care, our payroll costs are exponentially higher than in other rooms. Currently, we break even on just payroll costs in our infant and toddler spots. They do not cover any of their own admin costs, supplies, maintenance, and all of the many other costs that come with supporting and providing quality care for our youngest Mainers. I get calls every day for infant and toddler care. Currently, our wait list for just infant care is around 50 children. The need for those spots is great, but from a business perspective, it's not feasible to expand those classrooms, and in some cases, it's not feasible at all. We have the ability to expand the number of spots that we offer to infant and toddlers, and if we could make those spots profitable in our child care center, LD 1414 could provide the extra tuition to allow us to explore that option. Additionally, in a small town, the big employers are healthcare facilities and places of work that offer second and third shift. The need for non-traditional childcare hours is there. We often have parents reach out for non-traditional hours for care and have to turn those families down as we don't currently have the ability to support those hours. This bill would allow us to explore non-traditional care as an option. Thank you for your time, and I hope when you're making your decisions on LD 1414 that you consider my statements made by myself and my colleagues.
Thank you so much for being here for your testimony. Do we have any questions? Seeing none. Heather Martin is up. And then Jennifer Michaud.
It's great to see everyone, and my condolences for the loss of your colleague. It's very sad to see that empty chair today, and I know how deeply that affects you all. We will miss her dearly in this committee. My name is Heather Martin. I'm the co-executive director of the Maine Association for the Education of Young Children. Definitely here to testify in strong support of LD 1414. A lot of the great data was already pulled out, so I wanted to address, you asked a great question, Representative Graham, about what it kind of looks like in implementation on the ground, what a percentage increase means. So Right now, what Maine has to do every 3 years per the federal government is set a market rate across the state. They've moved to 2 regional market rates. There's 3 counties in one and the rest of the counties in another. That move was a result of a cost of care market analysis they did with a national organization that came in, did the evaluation, worked with programs across the state. What do you charge? What does it actually cost to pay your staff, to pay the bills, to pay the overhead? And so just to give you an idea of what that market rate told us, I pulled out just Aroostook because Katie was sitting next to me. In Aroostook County, that cost of care model told us that Katie should be taking in $448 a week for an infant per week. And that is to pay her staff a living wage, to pay her overhead, and to support that child in their care and support their quality. The current market rate is $244 that she receives for an infant. What this bill would do, it says a 20% increase over market rate. It would bring an additional $48 per week per infant in that area. So it would bring that up closer to $300. So we're closing a gap. We still wouldn't be there with the full cost of care of what we know. We talk about wages. We have some area to continue to improve on the supplement program, but it would at least bring it closer to make that gap less and make being able to serve infants and toddlers a little more sustainable. So that's why we think this is a good move. It's a system fix. It's not something that benefits one sector and not the other sector. This can benefit family childcare. It benefits Head Starts who do childcare services and interact with the subsidy program. It benefits nonprofit programs. It benefits private business programs. So it does have a broad effect across the sector, which is really great, I think, when you can put into implementation system fix that affect everyone. I also appreciate that Clara brought up the relationship of public pre-K expansion, because I think one thing we see is while there is good intention to want to promote pre-K partnerships, and we're seeing that done really well in some communities, not done well at all in other communities. And unfortunately, what that does is close childcare businesses when we create competition for 3 and 4-year-olds. And they can't operate on the infant toddlers. You've heard the data, you know the business model, why. And so we see that this legislation infused with, I think some hopeful potential fixes we talked to your friends across the hall about in pre-K expansion. We build a better comprehensive system and stop looking at childs and buckets of ages and who deserves what. So thank you for your time. Really appreciate you hearing about this legislation.
Thanks so much for your testimony,
Absolutely.
Heather. Do you have any questions for Heather? Yes, Representative Graham.
Thank you, Mr. Chair. Thank you, Heather. Nice to see you again.
Thank you. Good to see you.
You brought up the public pre-K dilemma.
Yeah.
I know in my community, we're having a real battle
Yep.
around it. The school board is really facing a lot of unrest about it. Can you help fashion how we can address that? This may be the way. Can you just kind of help me better get a handle around how we can make a difference for, daycares who are struggling because of these public pre-K? That's
I'll just speak from my knowledge of what we've seen around the country, because this is not independent of Maine, where we're challenged about what does public pre-K expansion mean versus, how we serve children in different age brackets. I think it comes down to how we fund it. And right now it's through a funding formula that does infuse state, federal and town municipal dollars. Even that doesn't reach the cost of care if you put it next to a cost of care model. But it also places the responsibility of the school system for the partnerships. So childcare programs don't have independent clout in the system, if that makes sense. Some states have attempted to structure it that regardless of whether you're a childcare, a school, you all have access to apply. And if you meet, the qualifications of being a public pre-K program, and in Maine, those are called the Chapter 124 standards, then you can have that money directed to you for those systems. It's almost another subsidy system, essentially, is what it's based out of. I think what happens, it's so inconsistent across school districts. Again, we see some of it happening beautifully in communities. The partnerships are great. The communities of practices, and just how can you infuse it together? In other districts, I think lack of resources, lack of understanding, or just that's a lot of trust as a school district to partner with a school building, a childcare program. It's a lot of trust for a childcare partner to partner with a public school. And it's accelerating, right? The system's moving faster with that shift of CDS oversight to school districts too. So I think we just haven't been able to keep a lot up quick enough to put the system fixes in. To me, I would love to see some sort of regulation where there is a requirement of how many community partners have to happen in communities. I think that's one way you start to think about creating more dialogue around partnerships is when you hold them accountable, because these are community businesses. Their teachers are using them for childcare. We can't have them close. You already know how hard it is to find childcare. So I think families want public pre-K expansion, but they also need that full day care. Childcare is a prime to do this. They do it already.
Thank you so much, Heather.
Thank you.
Other questions? Yes, Representative McCabe.
Thank you, Chair. Thank you for being here this
Thank you.
afternoon. Given the market analysis that you just shared just for Aroostook County, do you think that a 10% increase is enough to incentivize people to actually enter the market, also given the capital expenses of
Yeah.
cribs?
Yeah, I think it's a step into it. I think, does it bring it to a model where a program could still just up and run on infants and toddlers? Probably not. But what it does do is allows existing programs to sustain better. So maybe as they are losing some 3 or 4-year-olds, or maybe they're looking, maybe I could open one more classroom, but still have after school that helps offset that. It's going to offer an opportunity to think a little bit differently. I think if you think of 4 infants, and that's if your classroom is full of children eligible for subsidy at a $50 extra a week, that's $200 extra a week. It does start to make a little bit of a dent in that. But what I think it does, it starts to place a system fix in place. You mentioned the federal government. Yes, we'd love them to come around on big investments too. And that's when we have system fixes in places, then we're ready to infuse money better too and direct it at a more, targeted solution, which is raise these cost of rates for children and be able to cover more eligible families. We only cover around 10 to 14% of eligible families right now through subsidy. So being able to increase the number of folks that can access as well too. So it's, I would never dare say anything is the full system fix until we have the infusion of the investment it deserves. But it is the steps we need to keep taking.
Thank you.
Thank you. Appreciate it.
Jennifer Michaud, and then Rita Furlow.
Thank you. Senator Ingerson, Representative Meyer, and honorable members of the Health and Human Services Committee, good afternoon. I just wanted to answer your question real quick about ratio specifically, if that's still on your mind. State licensing regulations for infants ages 6 weeks to 12 months is 1:4. 12 months to 2.5 years is 1:5. 2.5 years to 3.5 years is 1:7, if that helps. My name is Jennifer Michaud. I'm a resident and childcare business owner in Sanford. For the past 20 years, I have owned and operated a Maine state licensed childcare program. My program provides care and early education services for children between the ages of 6 weeks to 11 years. Collectively spanning my 20 years of experience, my direct care and early education supervision includes over 500 children in York County. During this time, I have employed over 60 full-time educators and 15 part-time educators. I'm here today in strong support of LD 1414, an act to sustain Maine's childcare workforce. Thank you to President Senate Daughtry for sponsoring this critical legislation. As an employer, I want to be clear about what's been happening on the ground, as you've heard from many of the folks here today. These wages our early childcare educators are earning are far less than you can get even at your local Home Depot or gas stations. These professionals are responsible for the safety and development of our well-being of our youngest during the most critical years of brain development. This is not sustainable long-term, and it sends a clear message that our educators' work is just undervalued. LD 1414 takes these meaningful steps to change that. This bill, as you heard, is going to increase the CCAP payments from 10 to 20%. Heather gave a nice overview of what that would mean to us as providers. Although this market rate does not reflect the true cost of care for infants and toddlers, childcare business are routinely losing money at a rapid rate for infant and toddler care. Specifically, my program is licensed for 83 children. At this time, I only have 60, and I'm doing that intentionally. I want my quality of care to remain intact, and I want to remain true to our mission. I have a chance to open 3 more classrooms, and I don't know where I'm going to do with those rooms. I don't know if they're going to be infant, toddlers, or preschool. I also just signed an MOU with my local school department where next year we will be a public preschool site. I felt I was forced to do this knowing where this needle is going to move in our state. Although I dearly love our school department, we have a great partnership. So this has been a humble experience for us. But this is the reality of what we are dealing with today in childcare. With those empty classrooms, I will determine what we do to meet our community's needs. Will those be infant and toddlers? I'm not sure. We need your support to make that decision as business owners. This legislation also includes direct salary and supplements for educators caring for infants and toddlers. That's going to go straight to our workforce. That's going to empower them to stay in their positions. It's going to help them get more joint professional learning opportunities across the board. In addition, this grant proposes up to $10,000 for childcare programs to explore those non-traditional hours, something I also have explored. It's just not feasible for my business, bottom line. Many of my parents are for Maine Health. And right now, we have already modified our hours because I cannot afford to pay the overtime for our employees. That's just the reality we're working with today. In short, we are asking for your short-term investment for long-term results. I strongly urge you to support LD 1414. Thank you.
Thank you so much for your testimony. Do you have any questions?
Can I ask a quick question?
Sure.
You mentioned many of your parents are employed by Maine Health.
Correct.
Has there ever been consideration, or perhaps there's something in place where there is a partnership with a major employer?
I'm glad you asked that question. We have started conversations. I do a lot of collaboration with United Way of Southern Maine, and I know they are working on a campaign right now to help fill some of that void, but this is just the start. We need to get more resources and more people on board to start those conversations, but they are starting.
Excellent. Thank you.
Any questions? Seeing none. Rita Furlow.
Senator Ingerson, Representative Meyer, members of the Health and Human Services Committee. My name is Rita Furlow. It's a pleasure to see you all today. I am here in support of this bill to increase both infant and toddler care and support unusual different hours that can support families who are working evenings and weekends. Many of the points in my testimony have been covered, so I will just briefly highlight a few things. Obviously, care for infants is critical to their brain development. They need the kind of one-on-one care that obviously is required by these smaller ratios in order for them to really, for all those brain cells that are just rapidly forming, they literally form better when they are in strong relationships and get the kind of give and take. And that's why it's so critical to have those smaller ratios. You've heard about the wait list that exists, and I'm hoping you'll be addressing that in another bill, but that is another critical piece that we hope you can work on this year. And I'm also was happy to hear folks talking to you about the issues with public preschool. Tomorrow, there's a public hearing right next door in the Education Committee to expand public preschool to 3-year-olds. Frankly, we're in favor of that because of what is happening with child development services and the requirements that school districts now have legal responsibility for 3- and 4-year-olds under IDEA, the Individuals with Disabilities Education Act. So it is understandable that with that legal responsibility, that school districts are going to need to do that. But I think it's critical that this committee think about how can you work with the Education Committee on bills like this. There is so much overlap. There is so much cross work being done I would love to see you consider a subcommittee. I know these things aren't popular, but love to see you consider a subcommittee of a group of you who would be willing to work on some of these issues together to address what is right, a lot of cross-system work. And I see that, Senator Moore, I am done in terms of my time. So I am happy to answer any questions, but I thank you so much.
Thank you, Rita, for your testimony. Do we have any questions?
Yeah.
Yes, go ahead.
Nice to see you here in the
Nice.
committee room again. So I guess I'm going to go back to what I asked regarding the private sector and business and industry. And I believe I brought this up in the 131st, maybe even the 129th and the 130th. And that is, we get a room full of individuals here. Every voice in support of this bill. I hear you and I'm with you. What I don't see are the employers who are dependent on a workforce that is dependent on your workforce. So I wonder, is there an open dialogue with the private sector on helping this industry stay afloat so that their workforce can show up for work?
So I agree with you. I wish there were members of the business community here today, but I will tell you that there are very active members within our coalition who are incredibly concerned about childcare. It's why they've joined the Right from the Start Coalition, is to try to address this issue because it is a huge issue. You know, I will say that I think a number of them see perhaps that individual tax breaks may help their own particular company. And I think we all need to do a better job of trying to educate them about the system. And I think all of you understand how complicated it is. And so, yeah, to try to get folks to come here and leave their business sometimes is not easy. But I think we can absolutely work to make sure that you hear from them about this and other bills that you'll be seeing this session.
Thank you.
Absolutely.
Yes, Representative Graham.
Thank you. To follow up on Chair Meyer's question, are you aware of the Bath Iron Works new childcare and can you shift work, so on? Are you aware of what they're doing, and could you maybe share it with us?
Yes, and definitely a very active member of our coalition was the partner with Bath Iron Works to create and expand. I will tell you, I know that she is still struggling to hire staff. Absolutely. So, right, that is the basis of all of this, right? That if we can't pay high enough wages to these educators, we're going to be stuck. So that is, rather than tax breaks, that is really where we need to focus is the wages, so that we can, right, retain people who can go make more at McDonald's or Home Depot and have better benefits. That's the bottom line. So.
Any further questions? Seeing none, thank you so much. We do have testimony and support that's coming in on Zoom. Hannah Marshall. Hi, Hannah.
Hi.
I'm just going to remind you, we're on a 3-minute time clock, so go ahead and start whenever you're ready.
All right, sounds good. My name is Hannah Marshall. I'm the Executive Director of Space to Thrive, a nonprofit childcare in Windham and in Raymond. I'm writing to express my support for LD 1414, and I was intending to be in Augusta today. However, with all of the illnesses going around, I have been in classrooms all day. So I wanted to share that our program recently opened an early childhood education center in Windham. Many of you in the room were at our grand opening event in September. The center was only possible because of state investments in childcare infrastructure. I want to thank this committee for your ongoing support of this field and for the progress that has been made over the last few years. I also wanted to share a little bit about our current enrollment, our wait list, and the impact to our financial projections. At our new center, we have 5 classrooms, 2 public pre-K classrooms, a 3s-room toddler, and an infant room. Our current wait list has 4 preschoolers, 9 3-year-olds, 15 toddlers, and more than 25 infants. We just opened in September. We have done 0 advertising for these spots. I've also gotten multiple inquiries for infant spots for 2027, expecting parents who know they need to get on a wait list for infant care before they know if their pregnancy is viable. Many of these families are also asking, do you accept CCAP, knowing that they can only seek care at a program partnered with this important system? We assure them that yes, we do, and yes, we can add them to our 2027 list because our anticipated classrooms are not quite yet full. To meet the need of our community, we're hoping to shifting our classrooms to have 1 pre-K classroom to allow 16 additional infant and toddler spots. There are several other high-quality pre-K programs in our community that can absorb these pre-K students. However, making this change to more infant and toddler care is not financially possible unless we raise our rates astronomically or find alternative funding. Parents cannot afford infant care at $500 per week, but we cannot afford to pay our staff if we expand our infant and toddler slots and keep the rates the same. You've heard from several others about the importance of infant and toddler education. I believe that all of you on this committee understand that this care goes far beyond babysitting, and I also believe that you understand the impact on the economy if parents do not have access to quality childcare. I urge you to support LD 1414 so that programs like ours can meet the needs of our Maine communities. Thank you.
Thank you, Hannah, for your testimony. Do you have any questions? I also understand you're testifying on the other bill this afternoon. Will you still be available?
Yes, I will.
Thank you. Thanks so much.
Bye.
Good afternoon, Representative Meyer and esteemed colleagues on the Health and Human Services Committee. As you know, I'm Senator Henry Ingwerson, and I proudly represent Senate District 32, which includes Arundel, Biddeford, Dayton, Hollis, and Lyman. Today, I'm pleased to testify in support of President Daughtry's bill, LD 1414, an act to support and sustain Maine child care workforce. As a former public school teacher and grandfather, I know how important it is to invest early in our children and in our youth. That's why in October, I was delighted to accompany President Daughtry as part of her statewide child care listening tour to St. Louis Child Care Development Center as part of Catholic Charities of Maine in Biddeford. During that visit, we learned about the high-quality child care that St. Louis has been delivering to children of all backgrounds and needs for over 35 years. Indeed, the center has extensive experience navigating Maine's child care system, and they excel at working with families from all walks of life. I especially appreciated their comments and feedback on how we can make the child care system less burdensome for care providers and for families alike. The bill before us, is direct response to that feedback. The child care workers at St. Louis emphasize the importance of predictability and stability of state child care programs for centers to keep their doors open and to retain staff. We need to continue to fund and to support the child care subsidy program. And we need to be creative, making new grants available to support this essential infrastructure. It's why I also proudly sponsored a bill to establish and continue the Child Care Employment Award, which is coming up. I'm grateful to the Senate President for sponsoring this bill and making childcare a priority. With these critical investments, we can support Mainers with children and folks who take care of our children and make it easier and more affordable to start a family here in Maine. I thank the committee for its time.
Thank you, Senator. Questions? Seeing none. So that concludes testimony in support. Okay. Do we have testimony in opposition? Or is there anybody else? Dusty, are you? We haven't opened up the next public hearing. We're still,
Sorry to confuse.
This one too. Mine is for both, so I don't care.
okay. If you'd like to come up and provide testimony now on both, that would be fine.
We won't forget.
Yes, we
For
will.
yourselves.
Well, you might.
It's my bill.
You might forget. I feel a little awkward though,
You got a
going
little
after you.
confusing
Here
around this
you were to close it
bridging
out.
Over that we're doing.
Well, good afternoon. Thank you. Sorry for the confusion. I am Desi Homan Sprague. I'm the Executive Director of the Maine Women's Lobby, and I'm delighted to be here in support of both LD 1414 and LD 2066. Thanks to the Senate President, and of course, thank you to Senator Ingerson for these important bills. After hearing the really interesting and lively conversation that preceded me, I'm sort of scrapping much of what is in my written testimony, just to add, connect a couple of the dots that were laid out for you by my colleagues, particularly what I heard from Heather Martin and Rita Furlow. My colleague Lily was here yesterday about the direct care work, and I know that that was a really moving conversation. And I just urge you to think about that set of bills and this set of bills as addressing the same problem, which is our care infrastructure. Care has traditionally, for centuries, been delivered at no cost to the economy by women. And so when women entered the workforce, or white women entered the workforce, we neglected to build the care systems that would ensure that that could happen. In fact, when in 1977 in the National Women's Conference, there was a push to not only have the Equal Rights Amendment, but also universal child care. It almost happened. President Nixon was a huge proponent of universal child care. And we were just a couple of votes short of nationalized universal child care because of what you heard here today, that families cannot enter the workforce if they don't have care. But caregiving systems are among the most underpaid systems in our entire economy, because we never envisioned what it looked like to make that workable and part of a comprehensive system. The bills here before you today and yesterday do not solve the comprehensive problem, but as you heard, they really work to chip away at ensuring that these really underpaid and undervalued care workers are getting the compensation that they need to stabilize their workforce and therefore stabilize our economy so that people, mostly women, can join the workforce. Care, either direct care for older adults or for children, is the single highest reason why women who would otherwise be full-time employers or full-time employed must leave the workforce entirely or work part-time. So I appreciate the opportunity to unexpectedly go on my 1977 tirade. Not what I intended to do, but I hope that helps make some of the connections between gender equity and our economy that you'll hear yesterday, today, and throughout this session. Thank you.
Thank you, Desti. Questions from the committee? I'm seeing none.
Okay, thanks. Appreciate it.
I love those days.
Yep, we all do. Welcome.
Thank you. Good afternoon, Representative Meyer, members of the Health and Human Services Committee. My name is Maura Pillsbury, and I am a policy analyst at Maine Center for Economic Policy. We are testifying today in support of both LD 1414 and LD 2066. And I'm going to do what a couple of folks did before me, which is just state that you have my testimony. It repeats a lot of what you've already heard. So I won't read through it, but I did just want to highlight a couple of points and encourage you to think about the broad economic impact that childcare has. You've already heard it's the workforce behind the workforce, and it's one of the primary reasons that people are unable to enter the workforce, and that when childcare is unavailable or unaffordable, Mainers leave the workforce, which particularly impacts women and rural areas in our state. Ending this program will push even more parents, especially mothers, out of the workforce, limiting economic growth and household incomes. Childcare is really an economic issue. We need wage subsidies because the market doesn't work on its own. Childcare workers play a critical role in our society, and this program is an investment in the future of Maine's economy and workforce, and we urge the committee to support it. And since I have just a couple of minutes left, I don't often do this, but I just wanted to share my own personal experience. As a parent myself, I left the workforce because childcare was unaffordable to me, and I count myself lucky that my employer was willing to have me with a gap in my work history. I didn't know if I would ever have another opportunity to pursue my profession, and I know, or return to the workforce, and I know that I'm not alone. So thank you so much. Happy to answer any questions.
Thank you. Questions from the committee? Yes, Representative Zager.
Thank you, Madam Chair. Very supportive of the bill and concept, and but I have a question since your expertise is economic. And childcare is in my opinion, a colossal market failure, right? And that's not just like we seem to treat it as a marketplace, and yet there's all these positive externalities and things that don't make it work. Why hasn't the market found a solution? I mean, are there group? I mean, I see, like Ready Nation is like saying this is has a lot to do with our economy. MECEP is saying this has a lot to do with our economy. Presumably, people who are self-interested, for a thriving economy would want good childcare for all the reasons that people have testified on. Any ideas why that hasn't happened?
I think that's a great question, Representative Zager. And I would expect, more advocacy coming from the private sector for, support for childcare. We've certainly seen some employers who recognize the value of it and then provide it to their employees, which is wonderful. But because it's occurring on such a, broad basis, like the lack of affordable childcare, the market just hasn't been able to meet the need. And it's really, we would argue, needs to be subsidized by the government because it's a public good. So I will say, to Rita's point about tax breaks, that's where I usually spend my time. I'm a tax policy analyst, and I've just entered this childcare space. So I will say it baffles me because I see us give away many, many millions of dollars in tax breaks to businesses every year. And comparatively, this is just such a small amount of money for such a big impact. So I really think it's just a market failure that needs to be subsidized by the government, in our opinion.
Okay.
Yeah.
Well, appreciate your expertise. Thank you.
Thank you.
Seeing no other questions, thanks for being here.
Thank you.
So any other testimony in support of this bill or a combination of this and the next bill? Seeing none. Testimony in opposition? Testimony neither for nor against, but with additional information for the committee to consider? Nobody on Zoom? So I'll close the public hearing on 1414 and open the public hearing on 2066, presented by our own Senator Ingerson. Welcome.
Welcome. Good afternoon, Representative Meyer and esteemed colleagues on the Health and Human Services Committee. As you all know, I'm Senator Henry Ingerson, and I represent Senate District 32, which includes Arundel, Biddeford, Dayton, Hollis, and Lyman. Today, I'm so pleased to introduce my bill, LD 2066, an act to establish the Child Care Employment Award. At its core, this bill recognizes a simple truth. Our child care system cannot function without the educators and staff who show up every day to care for Maine's youngest children. And those workers must be able to afford child care themselves. The Child Care Employment Award is a proven workforce retention tool. Child care educators are, quote, the workforce behind the workforce. They make it possible for nurses, teachers, construction workers, small business owners, and countless others to go to work each day. Yet, childcare workers themselves remain among the lowest paid professionals in our state. One of the most common reasons educators leave this field is not a lack of dedication, nor training. It's the inability to afford childcare for their own children. The Child Care Employment Award directly addresses this barrier by retaining childcare workers. As of September 2025, the program supports 511 children from 313 working families, meaning hundreds of childcare educators are able to remain employed in licensed childcare programs because this support exists for them. Without the Child Care Employment Award, these experienced educators would otherwise be forced to reduce their hours or leave the field entirely, plunging the childcare system into an even deeper crisis. Let me be clear about this. Currently, demand far exceeds supply, and the wait list isn't really moving anywhere. The program is operating at full capacity, and there are 470 children from 312 families on the wait list. Even more concerning is that this wait list has not moved since October of 2024, 15 months ago. Yet these families are still working in childcare programs, supporting Maine's economy, and still finding themselves unable to access the help they need. What does this level of unmet demand indicate? The program is meeting a real and urgent workforce need. Unless we continue this pilot into a permanent program, hundreds of educators risk losing the stability that allows them to stay in the field. The Child Care Employment Award supplements funding from the Child Care Affordability Program. Therefore, this bill does not create duplication or inefficiency. Instead, it seeks to maximize existing public investments. In fact, 62% of participating families are eligible for the Child Care Affordability Program and receive CCAP subsidies. Where does the Child Care Employment Award fit in? It covers the required co-payments. The average weekly co-payment covered is approximately $114, a cost that would otherwise fall squarely on the child care workers who are earning these low wages. The remaining 38% of families earn too much to qualify for CCAP, but they still have barriers to affording and accessing childcare. The Child Care Employment Award fills this gap, ensuring subsidy dollars are used first when available and targeted support is provided only where it is needed. This braided approach stretches CCAP dollars further and strengthens the entire child care subsidy program. At the same time, it supports children during their most critical development years. 23% are infants and toddlers, 35% are preschool-age children, and 42% are school-age children. These percentages reflect the real lives of child care workers, many of whom have multiple children with different care needs. Importantly, the educators supported by this program are caring for children during the most rapid and critical period of brain development, as you heard in previous testimony. Research shows that more than 90% of brain development occurs before the age of 5. Furthermore, stable, responsive relationships with skilled caregivers are foundation to lifelong learning, health, and emotional well-being. In other words, when we invest in child care educators, we are also directly investing in early language development, social emotional skills, school readiness, long-term educational and economic outcomes. Workforce instability weakens these relationships, and retention strengthens them. Fortunately, the Child Care Employment Award is not a new idea. LD 2066 builds on a successful pilot program. At the beginning, the Child Care Employment Award was intentionally launched as a 2-year pilot to test design, implementation, and demand. The results are clear: strong uptake, effective coordination with CCAP, and significant unmet need. LD 2066 allows Maine to build on what is working, rather than dismantling a program that educators, employers, and families now rely on. And the Child Care Employment Award isn't just successful in Maine. Other states show this approach works as well. States such as Kentucky have adopted categorical eligibility for child care workers, ensuring that the people caring for young children can access affordable child care themselves. Early outcomes from these policies show improved recruitment, higher retention, and greater program stability. The Child Care Employment Award aligns with this proven approach, tailored to Maine's child care subsidy system and workforce realities. Finally, the Child Care Employment Award is an investment in Maine's economy. When childcare workers can afford childcare for their own children, staffing levels stabilize, classrooms stay open, and parents across all sectors can continue working. This program is not simply a benefit for individual educators. It is an essential infrastructure. And there is another thing we can consider as lawmakers. When a program is fully utilized and demonstrating strong demand and clearly working as intended, then our responsibility is to sustain that. Too often, pilot programs that are fundamentally helping Maine people are allowed to expire, not because they failed, but because they succeeded and outgrew their initial scope. The Child Care Employment Award, on the other hand, is exactly the kind of program pilots are meant to produce. It is well designed, it is data-driven, and it's responsible to a real need that isn't going anywhere anytime soon. Letting it lapse would undermine both workforce stability and child development in Maine. I thank this committee for its time, and I'd be happy to answer any questions, or they could be answered by those coming after me.
Thank you, Senator. Questions for the bill sponsor?
Thank you,
Seeing
everybody.
none. So we've got a list, and it begins with Charlotte Jacobs. Charlotte's still here, or did she testify on both? She combined, okay. How about Chantel Pettingill?
Good afternoon, Chairman and Chairwoman and distinguished members of the Health and Human Service Committee. Again, my name is Chantel Pettingill. I'm the owner of Pettingill Academy with our 3 large centers in Lewiston, Brunswick, and Auburn. I'm also a certified teacher of the state of Maine. I live in Monmouth, and I'm also a child care business coach with the Child Care Success Academy. So I get to work with child care providers from across the country as well as Canada and the UK in helping them develop their child care businesses. With our 3 schools, we're licensed for 484 children, and we currently employ an average of 80 teachers and administrators. And I'm in strong support of LD 2066. The Child Care Employment Subsidy has been a positive support for both my staff and my centers, but its current limitations make it difficult to rely on consistently. In 2021, before the subsidy was available, I offered free childcare to my staff as one of my, because we only had 1 center at the time, as a retention strategy. With 15 staff children enrolled, it resulted in a loss of approximately $187,000 in tuition revenue on the year due to not being able to fill it with a paying tuition. For an industry operating on extremely thin margins, this was not sustainable. As costs continue to rise, food, wages, and especially insurance, I have had to since move to a discounted tuition for staff's children, sorry. Insurance costs for childcare programs nationwide have increased over 200%. Today, wages account for roughly 65% of our revenue compared to the 28 to 40% in other labor-intensive industries. And that's fairly low for some businesses. I know of centers that it's up to 80% of their revenue. While a healthy business typically operates with a 35% profit margin, the average childcare margin in Maine is 3 to 5%. In some states, they're lucky if they can hit 12 to 15. While the subsidy was first introduced, only about 25% of my eligible staff were eligible to assess it before the funds ran out. For the past 18 months, no new teachers have really been accepted into it, and we're now seeing movement a little bit. But due to past experience, we're not actively promoting the program unless teachers ask us, because it's meant the significant amount of paperwork with no results is hard to go through our days with. As a result, many teachers still pay about 50% tuition, which causes us to lose approximately $120,000 a year in revenue. LD 2066 is crucial. It supports the financial health of childcare programs while allowing us to offer a meaningful benefit to the very educators we're trying hard to recruit and retain. Stable childcare programs mean stable childcare access for Maine families and a stronger workforce for the entire state. Thank you for your time and consideration, and don't ever hesitate to contact me at my email below. I'd be happy to speak further, including sharing insights from my nation-level work on the issue as well.
Thank you. Questions? Yes, Representative Zager.
Thank you, Madam Chair. Appreciate you testifying on both bills. Did you say that insurance has gone up 200%, so it's tripled? And how
Yeah.
much time?
So right now in Maine, we're seeing it a lot with home-based childcare providers. I've been lucky. My insurance only really went up about $6,000 last year, which is still a huge jump. But a lot of insurance companies right now are dropping childcare because of the liability. You can have a clean record, and a lot of them are just like, we're not doing childcare anymore. Sorry, you have to find some place. Maine still has about 3 right now that will insure us. But right now in other parts of the country, because I like to follow the trends going cross country, because eventually it will hit Maine. I have a friend in Georgia whose insurance went from $25,000 a year to almost $250,000 for her 2 schools. And Texas is seeing pretty similar numbers. So eventually it's going to hit Maine if it's happening in Georgia and Texas at the moment. Yeah.
Well, everything's big in Texas.
Yeah.
Thank you.
Do you have a question? Thanks. Thank you very much for your testimony. Bill Hager.
Thank you very much. And I will go very quickly because this is my second time up. I'm going to obviously also skip to the second page of my notes, simply to say that we, as the center, our 2 centers, took advantage of the program that was offered 2 years ago. We were able to hire 4 new staff people and open up, and each of which took a classroom on, so we were able to increase our capacity by 4 classrooms, over 45 kids. Without the program sustaining that, I don't know. It worked. And I love to come up with you folks, and you hear a lot of people coming up in this committee and saying it's not working. This one worked. You did a good job. I'm going to go off script and just address a couple of issues that came up in conversation, because there's very little institutional memory around childcare, because childcare grew organically in communities. It wasn't full blown and delivered to us from the feds like Head Start was. It doesn't have a 200-year tradition like public education does. The gap in income versus living began about 1970, and it's been increasing. So childcare grew organically everywhere. The problem is that we didn't do a very good job. So we were there so mom could work. That was the only reason we were there. Then we learned, but we're losing an opportunity because these kids aren't learning in our centers. So we started self-imposing and having external imposition of standards. Standards are good because we didn't know 50 years ago how important these years were. That science came later. We know that science now. So it is a market issue, but the problem is that the infrastructure, it has also become an infrastructure issue. We used to say in this biz, I want to be as important as sewers. I want the children to be in the same conversation as sewers. Because the same way that business person you mentioned isn't going to be able to afford to put in his own sewers, it needs an infrastructure for me to run my business. There needs to be a public infrastructure for childcare because the individual businesses can't bring it all themselves. There was an initiative for that very issue. It was called the Resource Development Centers that was funded about 20 years ago. And then about 12 years ago, under a different administration, they felt that was not a good use of money. They stopped funding it. So that initiative to get businesses involved regionally was eliminated in funding, as was tax credits for childcare. I helped write a bill. Mr. Shigori was involved at that point. That 20 years ago, under Start Me Right, that gave tax breaks incentives to do businesses in childcare. But it, again, was seen as being a low priority, and under another administration, it was cut. So we have been in and out because we haven't had a structural piece of the pie for our entire existence. So that's part of that answer. So thank you again. I appreciate the time.
Thank you. Appreciate your testimony. Questions? Seeing none. Eleanor Higgins. Will be Kim Russell next, and then Clara McConnell.
Hi again, Senator Ingerson, Representative Meyer, and members of the Committee on Health and Human Services. I'm Eleanor Higgins, and I'm the Executive Director of the Permanent Commission on the Status of Women. You have in front of you some things that I've already said on the last bill, and I'm taking note that perhaps I should have combined like others, but I appreciate your time. The one thing I just want to flag, and then I'll get out of your hair, is that in our 2024 report, one of the things we really dug into as we were thinking about women's economic security and labor and the workforce in Maine was that, as with other traditionally female-dominated care work professions, Dusty mentioned direct care work, low pay is a key driver of worker shortages and retention challenges, and you've heard about that from the people running these businesses here today. And the LD 2066 really builds on previous successes to stabilize the childcare workforce and retain the really talented early childhood educators that we have here in Maine by addressing childcare costs for educators with children of their own. And this type of investment, from our perspective, makes it possible for women and mothers and parents really to stay in this critical field that underpins the broader Maine economy. So the Maine Permanent Commission on the Status of Women is in support of LD 2066, and thank you for having me up here again. Thanks so much.
It's our pleasure to have you up. It's our job to listen to your testimony.
Thank you for that.
Questions? Seeing none. You're up, Kim.
So again, I'm Kim Russell. I'm the State Director of Ready Nation, and I'm here to testify in favor of Senator Ingerson's bill and thank him for putting it forward. I'm going to punt too, like a lot of folks, and most of my written testimony has been said by others, but I wanted to just draw your attention to a fact sheet that my office did on the childcare workforce and point out a couple things. One is that it's a very young workforce. The 60% of the folks are under the age of 40, and that it's 93% women and 93% white. On the backside is what we know is very low wages. And I wanted to try to address a little part of an answer to Representative Meyer's questions about where are the businesses. And I can't tell you the full story, but I can tell you what we know and what we hear. We mentioned Bath Iron Works example. They're struggling with a workforce, hiring a workforce because the wages are so low. We know that Jackson Lab built that gorgeous multi-million-dollar facility. Some of us were there for the opening. It's now closed because they can't hire and retain a workforce because the wages are so low. Bank of America during the pandemic started paying for childcare for its workers and have continued to do that. They're a big corporation. They can afford to do that. Not every small corporation or small business can afford to do that. There's a very interesting partnership going on right now with the Southern Maine United Way, so York and Cumberland counties, with the Greater Portland Chamber of Commerce. They said, we don't really know what we need to do for childcare, but we know that something has to be done. They created a separate 501c3. They're trying to build or retrofit, not build new, but retrofit buildings in South Portland, in Freeport, and in Biddeford. Biddeford's the last of the three in line to have childcare. They haven't opened one yet. They're trying to hire a community partner. These other folks have done, people that know childcare to capitalize those. We know in Skowhegan, for those of you who were on the education tour last Friday, gorgeous new wing, and first in Maine, first in New England, probably one of the first in the country, the whole new wing for children 6 months to pre-K age, right there at a school. The state school funding formula didn't pay for it. They raised $4 to $5 million, led by Sam Hite from a 115-year-old car dealership family. They raised private money to build that. The Maine Forest Products Council are building a childcare up in Portage, Maine, because they need childcare so that their workers can work in the mill. So that's not a complete answer, but there are some things that businesses are doing. They say they're not experts in childcare, but they know that something has to be done, and they're doing what they can. So I hope that's helpful. But the bottom line for all of them is the staff wages are so low. Even when you build the building, they can't hire staff, they can't keep staff, they can't retain staff.
Yeah, I mean, I very much appreciate that information, and to know that there are employers out there who are recognizing the need to get into to get into this issue if they want to attract and retain their own employees. And it sounds as though some of the movement toward opening up their own centers is fraught with many of the same issues around workforce
Yeah.
that
So to Representative Zegers, it's just a broken
I mean,
system.
I think that offering a benefit to an employee by buying some slots in an existing center, so that center has the stability of that, of that income coming in could be one way in which employers are helping their employees to deal with this very real problem.
Yep. Yeah, I think that's what they're trying to do with the new facilities they're bringing online in South Portland, Freeport, and Biddeford, because they've got
Is to buy slots at existing.
the
in
corporate
existing
supports for
childcare
those. So
centers.
in
Yeah.
exchange for their support will be
Yes.
a guaranteed for spots for their employees' kids.
Yeah, sounds like a great idea.
Yeah. So they're trying, like, we don't all know. We're all working within this system that's not really a system.
Yeah.
So it's hard, but thank you.
Understand. Yeah, appreciate the information.
Mm-hmm.
Clara McConnell. And I guess before Clara starts, it's not to say I don't see the role of state government in this. So it's just, I think that there are partnerships that can exist so that we're all addressing a very real problem. Sorry.
Fine. Chair Meyer, Chair Ingerson, and members of the committee, I'm Clara McConnell. I am here representing the YMCA Alliance of Northern New England, which includes the 15 YMCAs across Maine, and we are submitting testimony in support of LD 2066. As I mentioned before, collectively, the 15 YMCAs in Maine are the largest childcare provider in the state. So we see this issue firsthand. For our member YMCAs, the Child Care Employment Award is a critical investment in our most important asset, our skilled workforce, the educators that teach our state's children and allow us to offer consistent care for working families. From our perspective, Maine's pilot of the Child Care Employment Award has been a resounding success. And the only drawback has been that the limited funding has meant that many qualified educators are sitting on the wait list and not able to access the benefit. Establishing the program permanently with ongoing funding is an important step in the right direction. As you've heard, Maine's childcare system depends on a stable, qualified workforce, and yet childcare employees are among the lowest paid workers in the state. And let's see, I'll skip ahead so I don't repeat what others have said, but just know that for the YMCA's, recruiting and retaining qualified staff has been an incredible challenge, and it impacts the number of children that Ys can serve. Consistency is key when it comes to working with children, and the more consistent we are with staffing, the stronger our programs are. State-funded salary supplements are a critical way to provide better compensation for caring qualified educators while ensuring that childcare programs don't need to pass the wage increases along to families who certainly can't afford increased costs. So we support establishing the program permanently with ongoing funding. And we look forward, hopefully, to our educators being able to rely on this from year to year. For these reasons, we urge your support of LD 2066. Thank you.
Thank you. Questions from the committee? Do you recall what the initial funding was for this pilot? Sure, someone does.
I'm sure someone does. Heather, 2.5 million per year for the 2 years, each for the 2 years. So 5 total. Thanks, Heather, for the assist.
Thanks. Adam Good, followed by Jennifer. I don't have my,
testimony for both bills was incorporated earlier.
thank you, Adam. Jennifer.
I won't make you say the last thing.
Yeah, I can't read your handwriting anyway, plus something tells me I would have mangled it.
Nangled it?
No, not nangled. Nangled. Is nangled a verb?
To nangle something is to make fun.
Welcome.
Thank
It's the
you.
end of the day.
Yes.
We're a little punchy.
Yes,
but
that's
thank
okay.
you.
Yes. Good afternoon.
Welcome.
Thank you for the opportunity. My name is Jennifer Zantier. I am the executive director of Oxford SAC, a nonprofit multi-center childcare in Oxford, Norway, Otisfield, and Paris. I am here to express my support for LD 2066. The Child Care Employment Award is not just a benefit for educators, it is critical infrastructure that supports Maine's workforce and economy. When childcare employees cannot afford to care for their own children, they leave the field. When they leave, programs lose staff, classrooms close, and working parents lose care. Recently, our program held a professional development day focused on professionalism, education, and our commitment to children and families. As I prepared for that day, I kept thinking about the enormous expectations placed on early childhood educators. Their requirements to complete professional development annually, the strict licensing guidelines, safety standards, and all they do to care for Maine's children. Yet despite these expectations, early childhood educators are not compensated as the professionals they are. I was glad to see Senator Ingerson's use of the word professionals and educators in, talking about this bill. It was very nice to hear that. We just had a conversation in that professional development day about how to get that across to families, instead of using daycare to use, childcare and, so that we can educate people on what we actually do. Historically, many childcare programs like ours have tried supporting staff by offering reduced tuition or employee discounts for childcare. With rising operation costs like our liability insurance, food, utilities, supplies, programs can no longer absorb these discounts at levels we once could. At the same time, we can't keep raising tuition on families to try and pay staff a livable wage. That is simply not sustainable. This is where the Child Care Employment Award matters. In our rural Oxford Hills community, this award has become one of the few tools we have to remain competitive with other higher paying industries in our community. When the employment award first became available, our staff applied on the very first day. Many were placed on the waiting list. That alone shows how critical this support is. Today, 7 of my employees are eligible for the employment award, yet only 1 is receiving it. The others are still remaining on the waiting list. Supporting LD 2066 is an investment in childcare workers, working families, and Maine's economy. I urge you to support this bill and help ensure that people caring for Maine's children can afford to remain in this profession. Thank you for your time and consideration.
Thank you for being here. Questions? Yes, Representative Zager.
Thank you very much for being here. 30 hours a year of continuing training?
My full-time staff have a minimum of 30 hours because we are a level 4 on Rising Stars. Our staff have to do 40 hours.
Just for the record, that's about 3 times more than is required for an attorney in this state.
Just saying.
Yes. And I also wanted to say our program, as far as liability insurance, last year, our program paid $12,000 for liability insurance. This year, we had to pay $55,000 for liability insurance. And then a month later, our insurance dropped us because the underwriter didn't know that insurance company was no longer providing insurance for childcare either. So we did get another policy for like $35,000, but it had so many limitations. But what are we going to do? We had to accept it. So.
You're experiencing the same thing as
You're not on.
Yeah. Yeah.
So you're seeing the same thing Ms. Pettengill
Yes.
described for us.
Yes. And it is a nationwide, concern, and a lot of programs are seeing it.
Okay.
Yeah.
Thank you.
Licensing, childcare licensing is aware of it now, and this is a concern, not to go on a soapbox, but about, the off hours or the off hour, LD, the other bill. 1414 is, what impact is that going to have on insurance? Is that going to,
On overnight and
overnight
less
hours,
traditional shifts.
Yeah.
Yeah.
So Any other
Thank you.
questions? Okay, thank you.
Katie Gilmore. Followed by Heather, Jennifer, Rita, and April. Hi.
Good afternoon again. My name is Katie Gilmore. I'm a mother of 6 and the owner and director of Laugh and Learn Academy in Holton, where we currently employ 22 full and part-time staff and have 4 staff members that would qualify for the employment award. 3 staff had applied for the CCAP Child Care Employment Award as it first came out. 1 staff member received a half an award, and 2 of our staff members did not receive any award at all, despite applying as soon as the information was released. The last staff member is currently pregnant and will have to leave our facility if she cannot get subsidized childcare, not only removing her from the workforce, but putting a strain on the staff that are left in the classroom. All of this is to show the need for LD 2066. Of the two employees that did not receive an employment award, we as a business are currently incurring the cost of their childcare spots. There's 6 in total. These staff members need to work in order to support their families and are invaluable to us as a childcare center. However, they cannot afford childcare for themselves even after utilizing traditional CCAP, and is putting a significant financial strain on our business to cover the cost of their parent fees. This costs us currently around $28,808 and could cost us up to $50,000 a year if they no longer qualify for traditional CCAP or the CCAP Employment Awards, which has been a very real threat. Continuing and expanding the employment award would mean we can not only reduce the financial strain we currently endure, but also keep an additional staff member and market to potential employee candidates that would not otherwise be able to enter the workforce. These stories are of those in our center alone, but they are not unique to only us. Many childcares just like ours are struggling to staff and retain staff in our centers. The employee award is one way that you, as part of the Health and Human Services Committee, can help support us to provide high quality care. I ask that you please consider these stories as well as the statements of my colleagues as you make your decision on LD 2066.
Thank you. Questions from the committee? Seeing none.
Thank you.
Thank you for listening to me again. My name is Heather Martin, Co-Executive Director for the Maine Association for the Education of Young Children. So thank you, Senator Ingwerson, for sponsoring this legislation. Thank you, Representative Meyer, and members of the committee for hearing this testimony. We are in strong support again of this legislation. As you've heard, this was conducted as a pilot at first to see how it would work, based off the Kentucky model, which had really good success rates. They were trying to figure out how post-COVID, how do we get people in the workforce? And this was one of the predominantly popular ideas among their legislature to test and try out. And their reports and data actually showed good recruitment back to the workforce and good retention with that. So I appreciate that it's based in some data and reality of what educators are experiencing and what businesses are experiencing. You've heard from some business owners of what it means to try to offer free or reduced childcare as a recruitment benefit. Not a lot of other business industries can say, hey, we can give you childcare as a recruitment benefit. This is a really unique opportunity we have in childcare when we're thinking about a workforce that we want to grow and retain. What can we offer? We can give their kids a safe place to be during the day. So while they work, they know where their kids are. They might be down the hall. They might be in the family childcare home with them. And that's a good thing. Last year, I think I celebrated because on the national level, early childhood educators moved from the bottom 2% wage of earners now to the bottom 3%. So we celebrated a little, we moved that needle a little bit, but when in terms of their access to wages and then in additional benefits, they're just really non-existent. Last data I knew in Maine, we had about 50% of our childcare programs that were even able to offer health insurance. So we have to have some tactics in this industry and some recruitment benefits in this industry that draw people in. So when you're sitting there going, all right, am I going to work at Home Depot, or maybe I have some skills and opportunity in a childcare program. What is going to look better? Home Depot is not going to be able to support your childcare needs. In fact, you're going to be struggling with the rest of the economy trying to find and afford childcare. This benefit, again, would directly benefit the folks working in childcare, but then again, turn around because now they're opening up a classroom and spots for other people's kids. I think if we think of Senator Ingerson told us 313 employees are receiving this, which is supporting 511 children. Even if we lost 100 of those educators because this ends, think about the number of children per educator. You know, if you're an infant teacher, that you're losing 4 infant spots. If you're a pre-K teacher, you might be losing, up to 12 spots. So I think it's really important. And just to read from a provider herself, who you have her testimony, her family received the employment award from its inception. And they were paying $800 a month for one of their children on top of getting a discount already from their program who was trying to help them. So they have been able to save $800 a month as a family, and it kept her in the field. It made that difference of, do I go somewhere else? She has a master's degree. She could go to public school easy, and she stayed because this offered her the opportunity to stay in the field. So we hope you continue to support this. Again, it's good policy. It benefits across the sectors. It's not siloed to one space. And we would love to see it continue. Thank you.
Thank you, Heather. Questions? Yes, Representative.
Thank you, Heather.
Thank you.
Again, kind of that big picture question.
Yeah.
We know the federal government has said that they're decreasing support for early childcare education, maybe in some states more than others. Can you help us understand the impact that is having on Maine early care and education?
Yeah, so fortunately in Maine right now, we're not seeing a huge impact in terms of deficit of funding. What happened in the budget bill that was passed, it was flat funding for the Child Care and Development Block Grant, so Maine saw no increase. The most recent concerns around funding freezes, fortunately, Maine has not had implications of that yet, and it's my understanding that they're fulfilling the requirements of the reporting that has been added on top for drawing down federal money for subsidy. And so far, everything's gone smooth. I haven't heard from programs about any delays in any of that. So I think, Maine worked really hard to implement a new system, and you all were part of helping support and build that too. And I think, we've built some strong infrastructure here in terms of getting those federal dollars out. So there's not a great impact in terms of that, but I will say flat funding is a cut, right? So I think we need to talk in terms of flat funding. We're hoping, we also, advocate on the federal level. We did hear that the House Labor Committee did just pass legislation in the newest budget go around that kind of matches more with the Senate to provide some federal increases into the Child Care Development Block Grant, Head Start, and Preschool Development Grant. So we're hoping some compromises can be met there, and we do see some increases in federal funding. It's not significant, but again, when you're talking about operating on flat funding, that's a cut. And so the significant, this could hopefully overcome some of that. But yeah, I will say, thank goodness we are not super affected in terms of programs not getting their funding from subsidy. Yep.
Thanks.
Thank you.
Jennifer? Jennifer still here? I don't see her.
All right. Hello again. Thank you, Senator Ingerson, Representative Meyer, and honorable members of the Health and Human Services Committee. Good afternoon. My name is Jennifer Michaud, owner and director of Kids Cove Childcare in Sanford. I'm going to go a little off script, as many of my colleagues behind me have mentioned a lot of key points. One of the things I just want to add to this is, as a business owner for over 20 years, I have not been afforded the benefit to offer my employees health benefits, short-term disability, or any of those package deals. When I have an employee come to me in an interview, this employment award is one of the solid things I can give them right now. I can say to them, most of my employees are working mothers. And so to them, it's a benefit to work in the place where they can see their child. They also can give to the other children in their community. This has been able to afford me the luxury of keeping staff for the last 2 years. And without this, I'm afraid they might have to look elsewhere. And one of the things to consider is that when these children take a spot in our childcare center, they're taking a spot out of those ratios. And so we need to be compensated for that. And for employees who are starting in this field at $15 to $16.50 an hour, we're then going to ask them to pay for a full-time rate in a child care center. It doesn't make any sense. It really doesn't make any sense. The math is just not mathing. So I just strongly urge you to support this bill, LD 2066. And again, if you read my testimony, it's much of what my folks behind me have already said.
Thank you. Questions? Seeing none. Thanks for being here. Rita Furlow.
Sarah Ingerson, Representative Meyer, members of the committee. My name's Rita Furlow. And I am also going to just share with you something that you, I hope, have in your files somewhere. You recently should have received a report from the department that they did on this program. They hired an independent consultant, the Center for Early Learning Funding Equity. This is the first paragraph of the conclusion to the report. The Child Care Employment Award pilot demonstrates clear benefits for Maine's early childhood education workforce, particularly in supporting retention and improving the quality of life for staff with young children. Focus group participants and program data indicate that the award has helped many educators remain in their roles by providing financial, quality of life, and psychological benefits. The program also shows promise as a tool for recruitment, as several focus group participants reported that friends or acquaintances were drawn to the field after learning about the award. However, this potential was constrained once the program reached capacity and transitioned to a wait list. I agree completely with Bill Hager, who said this is something that worked very well. It worked very quickly. We were, I think, frankly, all surprised at the uptake, and that it really is an effective tool to help attract and retain staff. So I hope you will find a way to continue this program. So thank you.
Thank you, Rita. Questions? Seeing none? Last person I have on our list for in support is April Tardif. Did she give? Okay, that was a combined. Okay. Anybody else here that has a burning desire to speak to this bill? Anybody on Zoom? There is. Great. Hello.
All right, sorry, when I switch to panelist, it often turns off the sound for a minute.
Nice to see you again.
Yes, thank you for having me again. Just as a reminder, my name is Hannah Marshall. I'm the Executive Director of Space to Thrive. We're a nonprofit program in Windham and in Raymond. And I too am going to jump just to some specific data about our program. You've heard from a lot of people talking about how vital the Child Care Employment Award is. So we have 4 locations, 3 are school-age programs, and 1 early childhood facility, again, that we opened this past September. Our program has been in operation since about 2000 and has a long history of providing high-quality childcare in our community. One benefit that our board of directors has taken a lot of pride in offering to our employees is 100% tuition coverage for up to 1 child per employee. This year, across our 4 locations, we forego a total of $2,120 each week, more than $100,000 annually. For the first year since our program's opening more than 25 years ago, we will have to eliminate this benefit. The financial burden is not something we can continue to provide and stay open. And just to note, this is only for 1 child. Several of our employees pay for care for an additional 1 or 2 children beyond the first. That is, we absorb the cost of tuition. If we eliminate or reduce this benefit, we run the risk of losing our 7 staff members who are also parents. You are already aware there is a significant staffing shortage, and we cannot afford to lose 25% of our staff and continue to offer care for the families that depend on us. Separate from this, I also want to touch upon the conversation of corporate support for childcare spaces and just throw in my 2 cents from our community standpoint. Many of our parents in Windham and Raymond are self-employed. We have a lot of households where both parents do independent or contract work, such as snow plowing, farming, hairdressing, freelancing, etc. Our most common, our largest employer is RSU 14, our public school district. And so we partner with them in several ways. We also know they can't financially invest in a private childcare program, even when their staff are on our wait list and having to leave their teaching jobs due to a lack of care. So corporate sponsorships may be one means of bringing additional funding to childcare and early education fields, but it is not a full solution. This would still result in significant disparity and inequity, and I would just urge you to support this state investment to develop a truly accessible system. I urge you to pass LD 2066 to support children, educators, and childcare programs. Thank you for your time and consideration.
And thank you for being here once again today. Questions? I'm seeing none.
All right, thank you.
Anyone else, Sophie? No? Any testimony in opposition? Any testimony neither for nor against, but with additional information for the committee to consider? Does the committee have any questions or requests for additional info from our analyst? I'll close the public hearing. Any additional work for us to consider today? I'd entertain a motion to adjourn.
Motion to adjourn.